Very good afternoon to all present here. This time we are going to start for the post-lunch session of this 2 days international e-conference on geriatric physiotherapy, GERICON 2021. On behalf of the team, I will be welcoming everyone here, all the respected guests, chairpersons, speakers, participants, everyone. And now I would like to request Aroma Madam or Arunima Madam to please invite the chairperson of this session. Thank you.
Yeah, ma'am. Thank you, ma'am. So with all respect and gratitude, I take this great opportunity to introduce our next chairperson, Professor Sajiviti. Currently, Madam serves as a principal at Cooperative Institute of Health Sciences, Kannur. She has more than 18 years of teaching experience, published 4 papers in international journals, and Madam was a former Board of Studies chairman in Kannur University and currently a member of Board of Studies of Physiotherapy at Kerala University of Health Sciences. We are so privileged to have you here, Madam, to grace this event and host the session with our resource person, Dr. Shyam Krishna. Over to you, Madam. Saji, Madam, please.
Yes, thank you, Arunima, for the lovely words. And good evening, everyone. Hope I am audible to everyone.
Yes, ma'am.
Yes, madam.
First of all, let me congratulate the entire team behind GERICON, the management of the institution who supported this venture, the college principal, Professor Mahesh Babu sir, and the entire physiotherapy faculty and other faculty of the institution who have worked hard for the first ever international geriatric e-conference organized by Anjaneya College of Paramedical Sciences, Calicut. Now it's my duty and pleasure to welcome and introduce this session's resource person, Shyam Krishnan sir, who's currently working as the assistant professor, senior scale at Kasturba Medical College, Mangalore, under Manipal Academy of Higher Education, who's having 14 long years of teaching experience, and he has graduated and post-graduated from the same institution. He has authored nearly 30 publications in national as well as international peer-reviewed journals. And I'm very happy and privileged as I'm also a product of Kasturba Medical College, Mangalore. I graduated in the year 2001. And with immense pleasure, I welcome you, sir, and wish you a great session ahead regarding the topic geroscience. And I also wish best wishes for all those who are listening this session, the last session of this e-conference. And may the session add a lot to your knowledge. And over to you, sir, and wishing again best wishes for the entire session. Thank you all.
Thank you very much, ma'am, for the introduction. So I think I'll share it once again. My shared PowerPoint is not there anymore. So, I can start now, ma'am. Can I?
Yes,
Yes,
Hadi
sir.
ma'am, with
Yes,
your
sir.
permission, please.
Yes, sir, of course.
Okay. So, this topic essentially geroscience. If you basically go for a search, a Google search on geroscience, you'll basically reach a journal titled geroscience. That's the first search result which you're going to get. It's a high impact factor journal. It is a journal with a high citation index, and it is considered to be a Q1, our first quartile journal for research in gerontology and geriatrics. So that was like, that is the thing which you're going to get when you're going for a Google search. But what we need to know is that this is actually a very, very nascent field of research in geriatrics or in basically medicine per se. And to put it in very simple words, what does it mean is, it is looking at possibilities to expand the lifespan and something called as health span. Okay, so there are two terms which we'll be talking about here. That is, one is lifespan, the other one is health span. And so this is basically an area of science. As you can see, it is termed geroscience. So it is like a hard science rather than a clinical practice like orthopedics or medicine or other areas, or physiotherapy for that matter. So it is something to deal with the basic science. And this is experimentations in increasing human longevity. And we are first of all identifying what leads to aging, okay, and how we are going to basically look for that, the fountain of eternal youth. And that is what this whole scientific field is about. And it is very interesting. I have come across, as a part of this conference, I have read about it, and it's really fascinating. And I believe that we have a lot of scope of practice as well as research in this particular area. So I'll basically go ahead and start with the presentation. So, of all the periods in human history, so it is estimated that for approximately 200,000 years or 2 lakh years, we have been this bipedal Homo sapiens as we know today, or we basically branched out from the great apes and we became a species of our own. And out of these 200,000 years, the past 175 years has seen a rapid expansion in our life expectancy. Now, if you look at the statistics which is put here, every single decade, there has been an increase of 2.5 years in the human life expectancy within that period. And in some countries like Japan and highly industrialized and developed nations, in terms of HDI, Human Development Index, as well as in terms of industrialization, in those countries, there has been, if you really put it into perspective, there had been an increase of life expectancy of 6 hours per day, and that is among the longest lived countries. Now, the longest lived countries, you would base the one which basically comes to our mind would be essentially the Orientals, that is Japan as well as in China, and then some Mediterranean countries who seem to have a lot of protection against a lot of diseases, which we are going to discuss in the following slides. So this is the scenario right now. Now, the basic consequence of this increased longevity is essentially something which we all discussed yesterday. That is there are a lot of chronic health problems associated with aging, and and they have become common because of, now the thing is, people are living longer, so you tend to basically see diseases which develop after a certain age group. Probably the prevalence of Alzheimer's disease at the time of our independence must have been much smaller than what it is today. The reason could be because a major portion of the population probably wouldn't survive to that age when you see an Alzheimer's dementia. Similarly, what I was telling yesterday, technically, as per the current modeling of various inflammatory diseases as well as degenerative diseases show that at some point of time, all of us must be getting a degenerative joint disease or a inflammatory joint disease, but we don't get it. So many people don't get it because we don't survive long enough to have that. Similarly with cancers too, at some point of time, it is predicted that all of us have a probability to basically have a cancer. Some survive, some basically tend to get it earlier, some do not get it in their lifetime. So, as the global population is continuing to increase, there is going to be these issues which are associated with the aged population. Now, you have increased the longevity, but even now also we don't have concrete answers how to basically enhance the health of the people who basically are living these longer years. So, as the global population continues to age over the coming decades, the maladies of aging will threaten to overwhelm our healthcare infrastructure. It will disrupt our national economies, and the most evident factor would be, it would potentially poison the relationship between generations. That means, even now also probably I have seen in various clinical areas, because of the caregiver burden for that is associated with caring for an older person who is terminally ill, or who is basically having a chronic disabling condition. People tend to basically develop a kind of hostility. Nobody can be blamed for it. You can put it in cultural context and whatever it is, but it is, caregiver burden is real, and that essentially is going to poison the relationship among the generations. So that is the consequence of this increased longevity which is going to be there. So what we have been doing till now, for example, whenever we are doing a research, or whenever we are doing whenever we are talking about aging per se, our basic outlook towards aging is to look at aging, that is chronological aging, as a confounder of diseases or confounder of conditions that can happen. So, we basically say that when age increases, the chance of these things are more. Okay, and we see that the chronological age is just a confounder. So, age, whenever we have a discussion about aging, we tend to talk about the diseases which are associated with aging. Like what we look at, our current understanding is that if you look at any kind of chronic illness, if you look at it, we will see that age is basically one of the primary risk factors. You take cardiovascular disease, Alzheimer's, cancers, most of the kind of diseases, other than those genetical perturbations because of which you could have a disease like a type 1 diabetes or something. Other than that, most of the chronic diseases, when you think about, the single most biggest risk factor for that is actually an advancing age. So, this is again a statistics, a sample statistics which I have put, which essentially is from 2010 US statistics. Now, it basically shows the percentage of people being afflicted or dying from certain conditions like malignant neoplasms, diabetes mellitus, disease of the heart, influenza, pneumonia, etc. And you can see that as you fall into a greater decade of life, the probability of, right from 45 years onwards, you can see that the probability of a disease being disabling or basically causing a mortality increases. So, this is common for all populations. This is common in all ethnicities, all nationalities. It is common, but that is a common trend which we could observe over a period of time. Like, any disease is potentially more dangerous if you get it when you are aged. That is the reason you would have seen, like, in our clinics and all, many people like, elderly would walk in with a condition that is merely manageable. When you look at it, it is something, a simple diagnosis. Then it becomes very complicated. It reaches a stage where that acute crisis to homeostasis is so severe that it becomes impossible to revive, and probably, it leads to death, and or severe complications and morbidity after that. So, so age essentially is something which makes your chances of getting a disease higher, as well as when you get a disease, it even makes the chances of that disease being severe much higher. In the sense, the severity of the disease increases when you are older. So, like the traditional medical approach, which is, I have basically said that age, we look at it as a confounder, that is age, chronological age, or our physiological age, of whichever way we look at it. We basically consider it to be a confounder in the sense of a independent variable which can influence other dependent variables, kind of. So, we look at age as a confounder which can basically facilitate the onset of diseases. We never see age itself as a causal factor for disease. We don't say that, it is because of age somebody got stroke. Yeah, we may colloquially say it, but being in the medical field, we know that, or we assume that stroke is a cerebrovascular accident which has occurred because of an existing pathology. Now, we will actually have a lot of explanation for development of atherosclerotic plaques and how they are going to block the arteries and how circulation can be compromised and all. But there also, we are not essentially looking at age as a causative factor. We are basically saying that the effect of that particular condition is confounded with an advancing age. We don't call it as a causal factor. So, there are certain limitations for the traditional medical approach in geriatric. The traditional medical approach is essentially looking at the external manifestation of symptoms. We will come to that later. We will just look at the external manifestation of symptoms. We will see what organ system has been affected, what kind of pathology it is, and we tend to basically treat that. Now, what are the reasons why the traditional medical model or medical approach, is not completely successful in older population? Is the signs, symptoms, clinical manifestation, prognosis, and response to treatment of many chronic diseases vary with age, and there will be no specificity of symptoms, or the specificity of symptoms decrease. I'll give you an example. My father had taken a, a, a CT scan actually a few years back. He is in his he's approaching his 70s now, and uh, after the scan we found that there were many small infarcts actually, and thing is that none of them were symptomatic. None of them were actually symptomatic in his case. And similarly, when basically many of the elderly go for an MRI or a CT, basically when they come back, you would see that there would have been many lesions which has occurred over a period of time, but they would not have been symptomatic. In a young person, it would basically produce a predictable set of symptoms, or more or less predictable set of symptoms, but it may not produce same way in elderly. Similarly, a hyperglycemia may not actually produce any kind of symptoms in an elderly. Now it could be the reasons could be a myriad of those, because you accept that, yeah, I am old, so many things could happen to me, so a slight decline in functioning or a slight declining in wellness may not be taken seriously. That could be one of the reasons, but there is beyond that also it is there. So the signs, symptoms, clinical manifestation, prognosis and response to treatment in elderly to chronic diseases is different from younger population, and the specificity of symptoms decreases. You have a pathology, you're expecting a set of symptoms that may not be readily visible in the elderly. Now, the coexistence of multimorbidities and geriatric conditions, say for example, an older person, imagine a person who is about 60 years of age or 70 years of age, coming with take for example, an osteoarthritis, or a degenerative joint condition, or imagine is coming with a vertigo. Now the thing is that when you are going to select medications, or when you are going to prescribe a therapy for that person, this coexistence of the various morbidities which are there, like they would have diabetes, they might have hypertension, they might have some other age related disease. Now this basically blurs the diagnostic boundaries, so you would not be able to say the limitation which the person is experiencing is actually because of the new diagnosis, or is it because of the coexisting comorbidities. And this essentially complicates the selection of treatment. So treatment choices which you have would basically be limited, because you really are not sure whether the patient is going to improve if you treat the comorbidity or the actual diagnosis. Now the clinical course of disease in the elderly is confounded by the status of the host. Now the host is the person itself. Now the same disease, if you take a cohort of 10 old people, you're taking 10 old people with the same disease, now you would basically most probably see 10 different natural histories of that same disease in that cohort, probably, because the symptoms, the prognosis, etc. of the disease are modified by the factors which are inherent to that particular elderly. Whatever has happened in that person's body is going to determine the outcome of the disease also. Now, because of these three factors, the traditional medical approach in geriatric care is actually not successful. And that is the reason we need to have a specialty called as geriatrics or geriatric medicine. And we need to basically have a more integrated approach to look at these aspects which happen with aging, to deliver, informed, useful care to elderly patients. Now, we basically look at two different approaches actually. Traditionally, when you look at chronic diseases, take for example diabetes or hypertension or whatever it is, traditionally chronic diseases have been studied from the perspective of externally apparent clinical manifestation. That is, what essentially becomes apparent as a symptom or a sign. From the perspective of that, we have been actually addressing chronic diseases. Now, what this has led to is that obviously this has been successful in basically a lot of aspects. For example, we were successfully able to categorize certain cancers based upon the cell types that are involved, like lymphomas and all those things. But then we have been unsuccessful also. For example, yesterday what we were talking about, basically orthopedic conditions we classify as degenerative, as inflammatory, as autoimmune, like that. Now, now we know that it is actually not right to classify inflammatory and degenerative conditions as two different categories. So those categorization and arised out of this traditional model of investigation and epidemiology, where you would look at a disease from the perspective of the apparent clinical manifestation. Now, later on, we basically, with the advance in technology, we had greater access to identifying biochemical ingredients within our body, and those which we call it as biomarkers. Now, when we started with biomarker studies, we basically understood that sometimes diseases with often different molecular mechanisms, they converge to exhibit the same clinical manifestation. That means, the underlying molecular mechanism for a disease might be different, or some diseases might be different, but ultimately when they manifest in a person, they are going to manifest with similar kind of symptoms. The most common example would be, take for example, Alzheimer's. Now, Alzheimer's should ideally be used as an umbrella term for certain kinds of dementias which have similar clinical presentations. So the term Alzheimer's is actually derived from the clinical presentation from the clinical presentations. We basically have termed it as Alzheimer's disease. Now, when you look at the biomarkers, we basically will be able to classify, or we'll have subgroups of Alzheimer's patients who have different molecular mechanisms which are leading to the same kind of symptoms, that is depersonalization, loss of memory, etc., which is strange. Similarly, and conversely, what happens is that diseases with different phenotype presentation, that means diseases which present with different symptoms, signs, etc., they may share common biomarkers. So this knowledge we have got towards the later half of the 20th century, when our techniques to isolate enzymes, proteins, and other things from various kinds of liquids became better. And based on this, we have come to know that the same biomarkers can produce different manifestation, and different biomarkers can produce similar or convergent manifestations. Now, what we found with all these biomarker studies is that irrespective of a disease being there or not, these biomarkers are seen in aging too. The aging basically increases the appearance of these biomarkers in the body. So, this is basically from a population of Swedish women over a 9-year incidence of cardiovascular health. And now we can see that, yesterday a term was introduced by Dr. Ajim Shah, that is frailty. Now, this is basically the concentration or the quantity of biomarkers in frail, pre-frail, and non-frail elderly women actually. And you can see that all biomarkers are consistently increased in frail women compared to pre-frail and non-frail women. So, this is something which essentially is pushing the thought process that age is not just a confounder, or we basically say age is an immutable confounder. Age is an immutable confounder in the sense something which we cannot address upon. See, yesterday also when we saw many sessions, whenever we have put modified risk factor, age has never been a modifiable risk factor. Now, the reason why we don't put age as a modifiable risk factor is because we are considering the chronological age. That means the time from when you are born to the day when the examination or when the addressal is going on to that day. Now, if you take chronological age as a confounder, it is an immutable confounder, obviously. But the current understanding is that age is a modifiable. Now, physiological aging is different from chronological age. Okay. Now, as subsequently we go ahead, we will see that there are a lot of things which you can reverse in terms of the in terms of the biological systems. There are a lot of things which are reversible. So essentially, physiological aging, you should be able to you should be looking at it as like a ship of thesaurus or something, where you can part by part you can change, and you can change the whole. So physiological aging is not immutable. It essentially is modifiable, but then there is limitation. Nobody is going to live forever, irrespective of what kind of lifestyle anybody has, what kind of facilities are available. It probably is impossible for any species to basically attain immortality, other than some species which has achieved immortality through other mechanisms. But it's not possible for humans, at least. But age, from an immutable confounder, it basically looks like a mutable or an addressable causal agent. So the basic takeaway is that biology of aging is associated with chronic disease development through mechanisms which are beyond the time of risk factor exposure and cumulative effect of external risk factors. So aging has to be seen as a causal factor in disease development rather than like a mute spectator, which is like which cannot be addressed at all or which cannot be intervened upon at all. So that is what the basic takeaway from these kinds of philosophical musings were, in fact. So now basically we come to the main thing. So from these thought process evolved a basic nascent field of investigation, research and clinical practice, which is called as geroscience. Now it all started with something called as the geroscience hypothesis. Now the geroscience hypothesis posits that since aging physiology plays a major role in many, if not all, chronic diseases, therapeutically addressing aging physiology directly will prevent the onset or mitigate the severity of multiple chronic diseases. Now the basic to say is that, like, if you treat aging, that is physiological aging, chronological aging, nothing we can do about it. Every second we are aging. But physiological aging, if we are somehow able to arrest it or reverse it or bring about changes or modify it in some way, we should be able to basically reduce the occurrence of the chronic diseases which we usually associate with aging. And that is what the geroscience hypothesis is all about. Now, how did this whole thought process basically originate? Now the origin of this concept is actually in late 2010 or 2010 itself. During a workshop which was titled Indicators of Aging, organized by the Alliance for Aging Research, there was a discussion about the idea that aging, it basically started with an idea that aging is at the core of all chronic diseases. And further, the idea was built up and the idea was refined, and a plan was drawn to include various disciplines across healthcare and research spectrum to basically analyze or hypothesize this question and test it, that aging is actually the reason for diseases rather than diseases accelerating aging and the other way we used to look at it actually. So and finally this title called as this term called as geroscience was basically proposed by a researcher called Letko and his team. And the National Institute of Health basically adapted this term geroscience around 2014 to basically encompass this field of research, where you look at aging as a causal factor for disease, aging, and to look at ways to impede aging or stop aging or reverse aging in a way to address chronic diseases. So the basic tenets of this field, that is geroscience, is age is by far the major risk factor for most chronic diseases. That is we have already understood that aging encompasses biological changes most often seen as a decline of function and an increase in burden of diseases. There is this concept also addresses what I have already told you. There's a false belief that aging, like age, is immutable. Now, aging is basically the process of the progressive deterioration which we are associating with the body, which leads to a state where there is no chance of maintenance of homeostasis and finally death. That is what aging is. Now, age is basically the chronological number which we associate with ourselves, based upon our the time of birth or the date of birth. Now, aging, unlike age, it is mutable. Aging, is a mutable factor. That's what I had explained before. Now, the final aspect of this science is basically research into the basic molecular and cellular mechanisms of aging. Basically, can lead to potential interventions that can increase lifespan, and it increases health span as well. Now, health span is, for example, imagine you increase the lifespan of an organism. Now, when we come to the studies, we will come to know that further. Imagine you are increasing the lifespan of a person. So you have to increase the total age to which the person lives as 150. That is, the person is not going to die. Now, the thing is, imagine the person starts having various kinds of diseases, like, from the late 70s or 80s. That means, like, almost half of his entire life, he has been suffering. That's what is going to happen. So imagine, like, somebody who's going to live up to 150, 75 is basically his middle age. So from that age onwards, if you start having diseases which are potentially disabling, take, for example, osteoarthritis, or like, other degenerative joint conditions, or autoimmune disorders, or like, or connective tissue disorders, or some kind of non-painful but debilitating conditions like diabetes or hypertension or something like that. Now, for half of his age, he has to live with that, which essentially is not an ethical practice to be adopted. See, you basically, like, increasing age, and along with increasing age, there's an increasing suffering. It really doesn't make any sense. So, the other concept that has to be addressed is health span. That is, when you're increasing the lifespan, there has to be a way in which it ensures that the increased lifespan is lived with a better health, a youthful existence for a longer period of time. And that is what the whole basis of geroscience is. So, now for the purpose of, like, basically designing research or coming up with solutions, the founders of geroscience essentially identified 7 key areas which are the characteristics, or which are the causal factors for aging, or they are consequence as well as causes for age. Now, these were termed as the 7 pillars of aging. But then there were other groups simultaneously working along the same concept in Europe, and they came up with 9 concepts or 9 hallmarks of aging. Now we will see this in detail, and like, in brief, we'll see what they are, and then we will see the kind of research that goes on in these areas. So the 7 pillars of aging basically have been identified as, like, alterations in metabolism, stem cells and regeneration, changes to stem cells and regeneration, proteostasis, adaptation to stress, inflammation, epigenetics, and macromolecular damage. Now, I'll basically start with stem cell and regeneration. Now, essentially, if you look at an organism, a multicellular organism, okay, like our cells, there are cells which are pluripotent, or like, you can say they call them as totipotent.
Mr. Akhil, please keep your phone muted.
Yes, so there are, like, stem cells are essentially those cells. They are precursor cells for all kinds of cells. That means, if a stem cell is put in a cellular environment where it could develop into a neuron, it could develop into a neuron, it could develop into a myocyte, it could develop into a fibroblast, or whatever kind of cell it basically has to be. So, we all have stem cells reserves actually throughout our lifespan. Now, these stem cells are the ones which essentially transmute into useful cells whenever there is an injury or a repair process happening. Now, what is seen as a common change during aging is that we tend to exhaust our stem cell reserves, or those factors which signal stem cells to migrate to a certain area and to change into a transform or differentiate into a different cell type are basically affected. So the signaling pathways might be affected, the enzymes which mediate it might be affected, because of some reason, the stem cell reserves are basically become redundant, they become exhausted, and our regeneration potential decreases as a matter of that. So, our system's ability to heal decreases when there is alteration in the stem cell reserves, as well as the usefulness of stem cells. Now, the second one is proteostasis. Now, proteostasis is essentially our ability, or the ability of our molecular machines to basically transcribe proteins, to build proteins, to fold them into ideal shapes, as well as to create protein complexes, etc. Now, like, proteostasis essentially depends upon very, very, very precise molecular machinery. We would have all seen animations of mRNA moving into basically a ribosome, and from there a protein being synthesized and being sent out. Now, the thing is that you can imagine proteins as as large molecules. Like, some of them might have like 100 atoms, some of them might have thousands of atoms. Now, the thing is, when you have such a long or such a large molecule, see, it is not merely the chemical structure matters in the case of proteins. Now, protein folding means how the protein is shaped also matters. Now, there are various factors which determine the shape of proteins. Now, proteins you can imagine as Lego blocks, which when you put together, you basically make up the body. Now, it is not merely the synthesis of protein, but also the way the proteins are folded. The proteins are basically basically shaped, all matters in terms of proteostasis. Now, the mechanisms which underlie, essentially this protein folding and all are found to be defective when you age. As a result, there is an accumulation of a protein which is shaped wrongly. For example, your beta cells of islets of Langerhans are producing insulin. But imagine 5 out of all the 10 or 5 out of 10 insulin molecules which are basically synthesized and secreted have an altered shape, which basically cannot bind to a receptor. Obviously, there is going to be down regulation. There is going to be there's going to be it would basically lead to a hypoinsulinemia, because the structurally the protein is different. It is not going to be able to function as the normal insulin. So that is what proteostasis mechanisms are. The fidelity of the proteostasis mechanisms are lost in aging, and as a result, there is an error protein catastrophe. There's a theory of aging called as the error protein catastrophe. That is synthesis as well as appearance of proteins which might be similar in molecular structure, molecular composition, but which might be totally different in the three-dimensional structural organization. So that is basically the error catastrophe theory, what it says actually. So that is about proteostasis. Now the third is basically metabolism. Now essentially metabolism of the macromolecules, carbohydrate, fat, and protein metabolism. Okay, there is errors in metabolism which occurs with age. Errors in metabolism which occurs in age, in the sense it is not merely failure to metabolize a substrate. It is not merely that, but what also occurs is that the metabolic byproduct which are produced, for example, reactive oxygen species. Yesterday, Assis was talking about it. So what usually happens is that, what is the basis of this errors in metabolism? One of the key factors which has been associated with this errors in metabolism is that the quality of mitochondria, where oxidative phosphorylation occurs, basically decreases as you age. Now, why it decreases is, the structural proteins for mitochondria are deviant. The mitochondrial enzymes which are required for essentially neutralizing this reactive oxygen species, etc., which are produced as a result of, we say free radicals are produced because of single electron transfer, lipid peroxidation reactions, and all those things. Now, those kinds of mechanisms which are there are completely are completely or partially ineffective when you age, because of the changes which occur to the metabolic structure. And as a result, it is not merely an absence of a proper metabolism, but the metabolic end products becomes more and more vicious, which probably could cause greater damage over a period of time. That is what happens when you age. Now, macromolecular damage is very simple to understand. Now, this macromolecular damage can be attributed to the simplest of things, like a muscle tightness which you see in an elderly. For example, you take the tendo-Achilles of an elderly, or hamstring of an elderly. It would be tight, invariably tight. Now, that muscle tightness is because of yesterday we were discussing, whenever you are talking about tightness in the muscle, it is not because of actin myosin crossover. That is an energy intensive process. So because it requires ATP. So tightness in the muscle is because of the non-contractile components which are there, the collagen bundles which basically form the intramuscular septa, which continues as the tendon and all those things. And those elements in the musculotendinous structure is what is responsible for tightness. Now, what exactly is tightness? It is just like how your hair becomes curly when it is wet. What happens? Why hair becomes curly when it is wet is because the water molecules which are there in the hair, they tend to form weak hydrogen bonds between each other, and that is what creates that frizzy hair. The same thing is applicable to collagen also. Collagen is a long chain polymer. Collagen, when it folds upon itself, there can be weak covalent bonds or hydrogen bonds which are formed between sections of it, which basically is going to change the physical property of the tissue, because collagen is the one which is leading to the physical property of strength, stiffness, ductility, brittlity, etc. Now, when there is a change in the way collagen is folded and with the way collagen is basically located within the tissue, it is going to change the property of the tissue. So That is an example of a macromolecular damage. There can be other kinds of macromolecular damage also. Say, for example, cell membranes, the phospholipid membranes which are there. The way they are, the way those membranes function, the synthesis of receptors for certain kinds of ions or other kinds of hormones, etc. The way they are shaped. Now, when there is these kinds of errors in the synthesis as well as expression, what happens is that they become non-functional. So that is about macromolecular damage. Now, epigenetics is basically just like genetics. Epigenetics is how your genome responds to external stressors. See, this basically had we had ideas of this thanks to or we cannot say thanks to, but the ideas about this epigenetics arise from the Nuremberg trials, which was done after the Second World War, for the Nazi prisoners. Now, from their experiments, one of the experiments was the twin experiment. What they did was they mostly, I think probably the minorities of Jews who were there, they separated identical twins at the time of birth, and then they were brought up in two different environments. And since they share the same genetic material, technically, if only genetics was responsible for how you develop and age, then they should have actually developed equally and the same way. But they didn't do that. The identical twins who were participant in these experiments didn't develop like that. And that basically brought light to something called as epigenetics, that is the influence of the environment, on the expression of your genes actually. So genes basically, it is packed and compacted and put in the nucleus, and it is bound by the CH group and the histones, which basically tie it together. Now there has to be some, there are certain enzymes, like tropomerase and all those things, which essentially unpack certain areas of genes, which then will go, and express a protein. That's what usually happens in the molecular machinery. Now, those factors can be influenced by environmental effects like exercise, your lifestyle, your food intake. All those factors are epigenetic factors which essentially influence your genetic expression. So there is basically the epigenetic responsiveness essentially is hindered when you age. That's the reason it becomes difficult for an elderly person to basically adapt to a different climate zone than compared to a younger person. No, it might be a very lame example. To put it in very simple way, that is how it is going to manifest in an older person. What happens is that the way you are adapting to various environmental stimuli, that kind of adaptations may not be possible when you are older, because obviously the mechanisms which would be underlying those kind of adaptations have already been impaired. Now, the next thing is, one of the most common findings in elderly is a state of chronic inflammation, which is basically marked by the presence of inflammatory mediators like bradykinins, prostaglandins, interleukin-6, tumor necrosis factor, and all those things. The levels are elevated in elderly. Now, the reason why it is elevated, we do not know. Probably because of it is a vicious circle. And inflammation happens and then it keeps on building up. And this is responsible for most of the changes like sarcopenia and all, which are seen with elderly. Now, one of the major causal factor for sarcopenia is said to be the heightened inflammatory response which is seen in elderly with aging. Now, the final thing is adaptation to stress. Now, stress is something which threatens to off-put your homeostasis. It can be a psychological event, it can be a physiological event, it could be physical event. Anything which tends to off-put your homeostasis is basically a stress. Now, stress essentially leads to activation of the neuroendocrine axis, the hypothalamus, pituitary, adrenal axis. It basically causes release of corticosterone or cortisol for that matter, which again leads to pro-inflammatory mediators increasing. The most immediate effect of corticosteroid is cortisol, that is the hydrocortisone, is essentially to essentially to suppress the immune response as well as suppress inflammatory reactions. But over a prolonged period of time, the cortisol elevation is tend to basically cause an increase in inflammation, and those the adaptation to stress is offset when you are aged. There is a dysregulated increase in the endocrine effects. There's a dysregulated increase in the inflammatory markers which are associated with stress, etc. when you age. So that's the reason these have been called as the 7 pillars of aging. And whatever research has to happen to reverse aging, or to basically to address aging, or to look for like I was telling before, a fountain of eternal youth, basically has to address these factors, and it is only through addressing these factors you'd be able to unlock those answers. Now, the other one I was talking was about the 9 hallmarks of aging, which was basically found by a European working group. So, they basically found, they have termed as a genomic instability. Now, genomic instability basically can be termed as like your ability to consistently like express your genes in a manner which is facilitatory for your survival. For example, like our genes which transfer various proteins which facilitate our survival, they do it like a clockwork again and again and again. But after certain age, what happens is that this rhythm is disrupted. Okay, there will be random deviations in some places. Over a period of time, it builds up in such a way that it leads to like error protein buildup and all these things. Now, telomere attrition, that you would already be aware of, that what happens is that we always talk about a theory called as Hayflick's limit theory. That means Hayflick is somebody who isolated in 1960s like chick embryo. What he did was he put chick embryo in a perfect environmental condition where chick embryo can keep on dividing. Now, technically in such a perfect environment without any environmental influence, if a chick embryo is growing, what should ideally happen is that like the chick embryo should be it should be able to produce infinite generations of progeny. That means it should divide again and again and again. Subsequently, infinite generations it should be able to use. See, but what Hayflick found was that it is not possible. It is not happening at all. It wouldn't happen. Approximately after about 50 to 60 generations, it would stop. And then he experimented with different kinds of these kinds of stem cells, and he found that it is not possible for any species to have more than a limited number of cell divisions. The embryonic cells should have more than a limited number of cell divisions, and he termed that limit as Hayflick's limit. At that point of time, he didn't know why is it happening. Later on, we found that every time a cell divides into daughter cells, the telomere which is there basically shortens. So a daughter cell inhibits a shorter telomere than the parent cell. Now, after multiple generations, the telomere shortening is such that the viable genetic material which is there also gets cut down during the cell division, and that is what telomere attrition is all about. Epigenetic alterations we already talked about. Loss of proteostasis we talked about. Now, deregulated nutrient sensing is essentially our ability, our inability to basically select essential nutrients from our food sources and use it for proper anabolic functions. Now, that happens as a part of aging. Mitochondrial dysfunction, I already told what happens actually. And cellular senescence is a sum total of all these things happening, and cell becoming an old cell. Now, when we look at an old person, we see an old person with gray hair, wrinkles in skin, loose muscles, etc. Now, when you look at cell under a microscope, if you are seeing similar changes, not wrinkled skin and gray hair and all, but changes which are specific to cells, like a ragged mitochondria, leaking of cell organelle into the cytoplasm, etc., then that is called a cellular senescence actually. Now, stem cell exhaustion we already saw. Not altered intercellular communication. The transport of ions and other essential materials between cells can be altered. Okay, that is also said to be a reason why aging occurs. Now, these 9 hallmarks have been classified into various groups. That is primary hallmarks, which actually cause the damage, antagonistic hallmarks, which are responses to the damage, and integrative hallmarks, which are culprit of the phenotype, which ultimately leads to a person actually looking like an older person, or a person having a disease as an older person, or a person actually becoming whole. So like that, it has been classified into 3 groups. I'll not go into the details of that. So, essentially, this working group has set forward certain research goals to be addressed. Okay, to basically, these are the research goals, which will essentially tell us how to impede aging, or how to slow down aging, or how to reverse aging, or make a person live longer. Okay, and probably to make a person become immortal. Now, but that doesn't make any sense, because one of the theories of aging is called as disposable soma theory. Disposable soma theory basically states that the only thing which is useful about us from the perspective of the universe is our germ cells, which are capable of transmitting our genetic information to the future generations. Other than that, nothing of us is useful. So nature basically uses our body as a means of propagating our genetic information, and finally when it is done with it, it basically disposes it off. That is what the disposable soma theory says. So technically from the perspective of the species, it is it is imperative that members of the species die, otherwise overpopulation is obviously going to be detrimental for the existence of the species itself. So probably we'll never reach that stage, but these are the areas of research which has been underlined. So far, so far the studies have been done in animals, and obviously I put the picture of a cheetah here, or a leopard rather, but the studies have been done in 3 animals yet, that is fruit flies, earthworms, and mice. These are the 3 animals in which studies have been done. This experimental research has been done regarding geroscience to see what happens when you give when you give certain kinds of things, what happens when you regulate certain genes, etc. And based upon the knowledge which we have gained in this 6-year period, I told you 2014 is the time when geroscience started as a field of research where money was being pumped in and research was being conducted. So we are still in the first phase of trials of animal studies now. So the 3 different approaches which were used to delay aging was basically this. Now the first one would be the most strangest appearing to everybody, that is dietary restrictions. Now the idea of dietary restrictions initiated in the 1930s. Actually, in the 1930s, the idea started because of the experiments which were done on mice. It was by serendipity. It was found that the mice which were underfed tend to live longer than the mice which were overfed or which were given ample amount of food. Now this led to basically a theory of aging which is called as the calorie restriction theory, where it was assumed that a low calorie food, which is basically sufficient to sustain your basal metabolic rate plus your muscular activity, would basically increase your longevity and youthfulness compared to, now it is not just longevity, this also shown that there is an increase in your youth also is extended for a certain period of time. You live to be younger for a longer period of time compared to having a high calorific diet actually. So that is the origin of the dietary restrictions theory. Now the dietary restriction theory basically states, like I told you, okay, that calorie restriction can lead to basically expansion of lifespan. Now over a period of time, people have experimented with various kind of dietary restrictions, and they found that even restricting protein intake, not merely carbohydrates, but restricting protein intake or restricting fat or various kinds of combination of dietary input can affect the longevity as well as the health of the species in various ways. But the major drawback to this thing is there's a great variability between interspecies. Actually, the same kind of combinations which might be working in a mice cannot be adopted in a cat, or probably cannot be adopted in an elephant, because the mice and elephant are used to eating different things altogether. So so it will not be, it is not. So similarly, when it comes to humans also, it's going to be entirely different. So the dietary restrictions, they have been shown to increase lifespan in all the 3 test animals: mice, Drosophila, that is your fruit flies, as well as in worms. But no, it is not obviously experimental dieting protocols are there for humans to follow, but whether it produces similar biochemical effects or not, we don't know yet. Genetic modulation is basically trying to modulate certain known pathways which regulate inflammation. Essentially, the pathways in which insulin or insulin-like growth factors are involved, by modulating those using certain kind of chemicals or inhibitors, etc. And it has shown that genetic modulation can expand or constrict lifespan to a great extent, especially on these 2 pathways, insulin and insulin-like growth factor pathways. Now, the third kind of interventions were pharmacological. Now we will see here are a list of drugs which has been used actually to see whether it expands the lifespan or not. Now this percentage effect in males, which is put in effect in females, is a percentage increase in median lifespan which was actually observed with various drugs. Now this rapamycin, which you see progressively showing much, you can see some of the drugs are showing no change at all, but something called as rapamycin is the most consistent drug which is showing in various concentration and increase in lifespan in mice. This is done in mice. Now rapamycin is something which actually you apply on the stents and all to prevent organ rejection. Even in it's given even in after transplantations and all. Probably if Dr. Sheetal is there, she would be able to shed light on it much further. But rapamycin has been said to be a wonder drug, which basically reverses aging, at least in mice. Now, some of the other things. Now one thing which I want to point out is one is green tea extract. Now, we would have been drinking liters of green tea, like, assuming it to have an anti-aging, antioxidant effect. But at least in mice, it doesn't show anything. Similarly, I think this curcumin is basically turmeric. If it is so, then even that also doesn't have any kind of anti-aging effect. And surprisingly, introducing the female hormone estradiol, which is a precursor for estrogen, in males basically increases lifespan, but in females it doesn't show any change at all. So this is what about pharmacological agents what we have found. And this acarbose is basically a drug which is used for which is an anti-diabetic medication and an oral hypoglycemic, which is used in Europe basically. And this and metformin has been found to increase longevity. Now there is so there are a lot of trials going on to identify in people who are on metformin therapy to see whether there are reversible changes which are occurring because of the metformin being consumed. Now, we'll come to the final aspect from the perspective of physiotherapy. Now, the thing is, I said, see, the geroscience research basically aims to address these 7 pillars of pillars which have been identified as a part of aging. Now, the question is that and this is very focused on the molecular mechanisms. It is rather than having epidemiological evidence. See, now the problem with epidemiological evidence where we take a population and then we reject a null hypothesis based upon the p-value is that it may not actually reflect what is happening. So I really want all of you to see a video by a YouTube channel called as Veritasium, where he has discussed the fallacy of epidemiological studies, why the p-value based findings cannot be taken on face value. So the problem with epidemiological research is that you take 2 groups of people. I did this in this group, that in that group, their muscle growth increased this much. Okay, the generalizability is for that population. It could have methodological issues and all this. So that's the reason they emphasize on this molecular level research. So I went through articles to see if there has been research which connects physiotherapy with geroscience. And if you give a search in any of the major search engines with the regular mushrooms, you are not going to get anything. But ultimately, I was able to find with individual terms like exercise and geroscience and all. I was able to find a few articles where the mode of research is in such a way that it addresses these aspects. In fact, okay, or it basically the biomarkers or more molecular level changes are basically the outcome measures. So based upon that, I have projected a few studies. Now, there are some common goals for physiotherapy as well as geroscience. The science of geroscience has a practical purpose of adding life to years. That's what we said. We want to expand the lifespan. The overall goal of geroscience is to increase health span, which refers to extending the portion of the lifespan in which the individual experiences enjoyment, satisfaction, and wellness. Now, an important facet of this goal is preserving mobility, defined as the ability to move independently. And that is where our role comes. Now, we are the foremost professionals involved in enhancing mobility by means of either remedying, compensating, or making modifications in such a way that a person can move around effectively. Now, I will project a few studies which have been done. Now, innovations in geroscience to enhance mobility in older science. This was a research which was published in December 2020. Now, this is a review basically. It's not an original article. Now, it has basically collected articles over a period of time, and what they found was targeting multiple systems, including the brain and sensory organs, can improve mobility and function. But what I found of more importance to us is complex walking tasks which can be designed specifically to the person. That means, a highly customized walking task which is given to a person or a group of people tend to basically provide observable changes in mobility function, as well as it essentially brings about changes in other measurable biochemical factors like brain-derived neurotrophic factors, the motor unit reorganization within the spinal cord, etc. So this is the first study which I came across where they have addressed mobility as a part of a geroscience initiative. Now, another study which I found, which was again is regarding what kind of we all say that we all say exercise can bring about hypertrophy, exercise can bring about betterment of glucose tolerance in type 2 diabetes mellitus patients. Now, with these changes must actually be must actually be related to the changes in genetic expression which occurs at the level of the myocytes. Now, this particular study is about the effect of exercise on reversing age-related changes which are seen in the skeletal muscles. So, this essentially essentially assume that mitochondrial damage is the one factor which is responsible for which results in muscle weakness, and this mitochondrial damage was found to be reversible through exercise. It was found that the mitochondrial damage basically reverses, and it changes the transcriptome profile is basically the way proteins are transcribed by a cell. Okay, so exercising essentially brings about changes in the way in which your genetic your genome starts expressing proteins which are necessary or essential for survival as well as for maintenance of homeostasis. Now, see, this is essentially the whole explanation of the whole thing. Now, this study basically wanted, this is done in mice actually. So this study aimed to see if exercise actually changes the number of motor neurons which are there in the spinal cord, or does it change the characteristics of the motor neuron function, the alpha motor neuron functioning within the spinal cord or not. And they had basically taken mice for this study, and what they found was exercise training even in older mice. That means they had 3 cohorts of mice: older mice who exercised, and younger mice actually who are sedentary. Now, the older mice, with who were exercising, their the appearance of end plates as well as the appearance of the intricate protein machinery within their cells were similar to that of younger mice. So, they attributed the changes which were observed to observed in the molecular biology of the mice neurons to exercise actually. So, it basically improved end plate occupancy. End plate occupancy is that muscles, basically they say that when there's a sarcopenia, there is essentially denervation of muscle fiber, and denervation will basically leave a barren end plate there. Now, end plate occupancy is the ability of a neuron to basically make a synapse with an end plate, and that end plate occupancy improved with exercises. Now, the structural nuclear protein losses were attenuated with exercises. That means the protein loss which occurs, that is the negative protein balance which happens with aging, was reversed with exercises. Now, these studies are about exercise induced increase in brain derived neurotropic factors, both were the effect of see, in this study basically they had studied something like an endurance training, and the previous study they had actually studied resistance training, in fact. Okay, now in this study they basically the BDNF rising from exercise is in this study what they tried to evaluate was what they tried to explain was the mechanisms which are responsible for increase in brain derived neurotropic factor with exercise. And what you need to essentially know is that this brain derived neurotropic factor is expression within the hippocampal region has been shown to reverse, has been shown to arrest as well as slow the pathology of 2 major diseases of aging, that is depression as well as dementia. So here the diagram is self-explanatory. We don't know what factor exactly is released, but exercise releases, it is assumed that exercise would release a factor into the bloodstream from within the muscle, which essentially triggers a signaling pathway which ultimately leads to the release of BDNF at various areas of the brain. Now, again, this study is also a similar explanation regarding how exercise can lead to an improvement in brain derived neurotropic factors in various areas of the brain, which essentially improves the cognitive functioning in patients with Alzheimer's or in elderly in general. Now, now we come to an area. So this is the last part of the talk. See, we come to an area which we as a professional or we as profession has actually started neglecting over the past decade. Okay, now we assume we basically make a lot of assumptions that electrotherapy is useless, it is not effective. We basically go after fancy kinds of interventions, whereas there is still a group of researchers who still are studying the effect of various kind of physical agents on the way it works on the body. So I really wanted to project these two studies. So this basically say you are moving a muscle by voluntary control or by electrical stimulation, you imagine. Essentially, for a muscle contraction to occur, there has to be a binding of ATP to the two binding sites of myosin. The ATP has to split and become ADP, and then the muscle, the myosin head will flex, and then it would then again ATP has to be reattached and it will detach. That ATP synthesis has to be there. Now, whether the muscle is contracting with electrical stimulation or not, that has to be there. And when you are basically producing a metabolic stress, it definitely has to. Metabolic stress is a deterrent to homeostasis, and that definitely has to produce adaptive mechanisms from within the living organism. And so there is no way that you can discount electrical stimulation or the usefulness of electrical stimulation from regular clinical practice as well as from research. The only limitation to it, I believe, is the ignorance of a majority of our student population or our practicing professionals in choosing the right forms of, or choosing the right the parameters for treatment or research for that matter. So this study essentially studied the effect of neuromuscular electrical stimulation on skeletal muscle fiber remodeling and specific gene expression profile in healthy elderly. So one of the commonest things which we observe as a result of aging, which we say, is change of type 2 fibers to type 1 fibers in the muscles. That is fast twitch anaerobic fibers are basically converted to slow twitch anaerobic fibers, or type 2A fibers or type 1 fibers in older muscles, we say. Now, this study found that you basically can reverse that. You can basically change the profile or architecture of the muscle in terms of the fiber types based on the kind of stimulations you choose. Now, it increases protein synthesis. It basically it activated apoptotic pathways which were involved in differentiation of various cells. It increased the regeneration signals, and it basically increase the oxidative enzyme regulation. So all these were the effects which were observed at molecular level with electrical stimulation. Now, the last article is basically it was a review to see the evidence of using electrical stimulation to treat sarcopenia. Now, why it becomes important is that, imagine a bedridden elderly with an Alzheimer's whom you really cannot, or with some kind of a dementia or some kind of lack of volition. Now, there is no way you will be able to put that person into a structured exercise program. Now, the alternative would be to go for an electrical stimulation if it can produce similar effects actually. So, this study essentially found that there is compositional changes in the muscle with electrical stimulation, as well as it improves the glucose uptake and it increases the sensitivity of cell to insulin post-stimulation, which lasts for 3 to 4 hours, which is similar to what would happen when you actually exercise, voluntarily perform an exercise. So, so these are the areas of research which has come up. So, with that, I would want to basically wind up this talk. There's nothing further to speak. So, our goal would be to explore areas where, we focus more on research, which gives empirical evidence in terms of molecular factors and biomarkers, etc. So so this is all about my talk. If anybody has anything more to add about it, I really am welcoming anybody to do that, because this is all I could find about it. Thank you very much for listening so patiently.
Thank you, sir. Can I add a word?
Definitely.
Okay. Shampinson sir has given a wonderful explanation, literally going to the depth of the topic, molecular level, and about the very basic science of aging. And actually, this e-conference, this is the last topic of discussion, I feel. And GERICON has literally touched all aspects of aging and the holistic approach in terms of treatment. And actually, this area of geroscience, actually, it is unexplored, I feel, and
Absolutely.
in-depth knowledge you have given, and this has given so much of interest in that topic, because you have given each and every explanation in every level of human body. And usually I feel the major problem in elderly is difficulty in understanding the diagnosis, sir, what you have correctly said. And
Absolutely.
the actual diagnosis, and because of the comorbidities, actually, I feel even the doctors are in slight confusion, like, what to diagnose. Like, yeah, like your personal experience, I feel your father had multiple infarcts in the brain. And yeah, there was no symptom.
No
And the
symptom.
same, same experience I also have with my
Yes.
father-in-law. And actually the doctors were like, confused what to do and what to do about how to go about the treatment and all. Actually, you have explored so much in that area. And this is like, wonderful experience. And I feel like, great. It was a great talk, sir. It was a great talk. And I want to know if anybody has any, there are no doubts or anything written in the chat. If anybody can help me with that. Arunima?
Ma'am,
Arunima
Duna
ma'am
ma'am
is
is handling that session. I'll tell Duna ma'am.
Okay.
Duna ma'am.
think Duna madam
Yes,
is
kindly wait,
preparing.
please.
Yes,
I have
madam.
joined this.
And it is open to discussion along with Zoom participants, dignitaries, those who want to add any points or want to discuss anything. And Shyam sir is very keen to have interaction with everyone. And he personally posted an invitation in WhatsApp group for the speakers. So it will be
One question is there.
Yes, yes, madam.
Yes, I will be posting in Zoom chat box, sir.
Yes.
yes, yes. Saji madam, please.
This is
Sir,
Can I read?
Yes,
yeah,
I
Raj.
Rajkumar
Okay.
question. I saw that. Sir, question is exercise, stimulation, restricted diet to increase extendability of aging, but fasting and meditations have any evidence for extendability of aging process or not? See, fasting has, because like, when we are talking about calorie restriction, one of the strategies which they basically use was intermittent fasting. For example, feed the organism or the mice like 2 days in a week and next 3 days they don't, or 2 days they feed some kind of a diet, the next 3 days they basically reduce the nutrient content of that. So probably fasting, if you look at in humans, definitely no. Okay, in humans, obviously they have not yet done study to, and I don't think it would be ethical to basically do a study where you deliberately fast somebody. But like, in humans they have not done a study. Yeah, in other organisms, fasting has been proven to increase the life expectancy. But meditation, obviously, we cannot make other organisms meditate, so we don't know whether it will affect us or affect the aging or not. In humans, see, the thing is, the study about longevity, humans live like 20 years, or like 80 years or 85 years on an average. Now, to take a cohort of newborns and to study them over 90 years would be extremely difficult to really get the answer. You have to take somebody, you have to recruit them when they are born, and then you'll have to see that cohort over a period of time, just like the Birmingham heart study. It is in its 11th cohort or something now. So you'll have to see over the lifetime to see whether lifespan is increased or not, which is experimentally impossible to do unless and until you are going to go for a multi-generational cohort. So meditation, we don't know mostly. So probably it would. I don't know. It could actually.
Okay. No other doubt, I feel, because this
No
area
other
is
queries have
unexplored,
received, ma'am.
and he has explored in a great manner. That's why.
And whatever he said, it may seem like basics, madam, but it is the deepest knowledge.
That's what, sir.
Unless until we understand these things.
Yeah.
And when you said, I felt that this should be the first topic, but sorry, Shyam sir, we kept it at the last.
Yeah.
Okay, no problem, sir. See, I think it is ideal to be the last topic also, because this is the latest area of research for that matter in geriatric.
Yes, that's true.
Yeah.
I think it's fine. Like,
That's why we prefer this topic. And the terminology geroscience itself is new to many of our physiotherapists.
Yes, that is it.
Yeah, and it is really very vast topic to discuss.
It is.
And I don't know how you have cut in this so small. I think we provided 30 to 45 minutes maximum, but you have extended to one hour, more than 1 hour, but
Sorry
still you
for
can
that.
talk a lot.
I couldn't actually shorten it any further. If I had shortened it, it would have been very superficial. So that's the reason I couldn't actually.
Yeah.
Yes.
Okay, sir.
And
Thank
yes,
you
over
so
to
much.
Saji, madam.
Thank you, ma'am.
Yeah, thank you so much for the wonderful session. And
Thank you very much,
I
ma'am.
hope those who are listening, it must be a great experience for everybody, because this is a new area and you have gone so much ahead in that area. So it must be people who are interested in geriatric and the basic science of aging. You have shown a very good start, good start in the sense you have gone very ahead. But people like us, the very beginners in this area. So it is very interesting, sir. It was very interesting and very, very informative. And thank you for sharing your wonderful knowledge to this area of geriatric science, sir. Thank you so much.
Thank you very much, ma'am. Thank you very much for the kind words. And I'm really honored to be given this opportunity. And I thank every one of the organizer for this opportunity which has given to me.
Okay. Thank you for having me also. Thank you for the organizers, Mahesh sir, and the entire team of Anjaneya for organizing this e-conference in the first ever international e-conference in geriatric science. Thank you all. Thank you, sir.
Thank
Good
you,
night.
Dr. Shyam Krishnan and Professor Sajiviti, madam, for setting time aside from your heavy schedules to share some valuable information with our delegates. Thank you, madam. Thank you, sir.
Thank you, sir.
That was indeed a real knowledgeable session, sir. Thank you.
Thank you.
Thank you, madam. Thank you, Arnima, madam. And thank you all. And we request all to stay connected with us so that we'll proceed with the summary and then validity function and announcement of winners, and a lot of things are there. We request everyone to stay connected and the team.
Next, I call upon Ms. Nimsha Madam to summarize the event.
Aroma ma'am for calling me to summarize the session. I would like to take this opportunity to thank and appreciate the entire team of GERICON to conducting this first ever international e-conference on the topic physiotherapy care for older adults. And I would like to thank Dr. Chandramohan sir and Duna madam to providing us with all the support on and off the screen for the past 2 days. So I would like to summarize from yesterday's session. We had the first session chaired by Dr. P. Satya, and the speaker was Dr. Sheetal Raj. She has explained us about the comprehensive care in geriatric assessment and what all areas need to be covered while considering the geriatric assessment. And for the second session, we had the chairperson as Dr. L. Gladson Jose and speaker Dr. Vinil Pillai. He has covered the topic physiotherapy in aging spine and surgical spine. Sir has given us an idea about what all things to be taken care while we are dealing with the patients after surgery, especially about various risks and complications associated with it. And the third session, it was chaired by Professor Remya. The speaker was Dr. Anne Thomas on the topic adaptability in community among neurogeriatric conditions. And she explained us about what all things need to be planned and addressing how to address a problem and what all areas need to be covered while covering the management. And the fourth session, it was the chairperson was Dr. Jibu George Verghese, and speaker was Girish N. on the topic of balance and pulse. Even though it was a very familiar topic, sir has explained us about the identification, how to identify the balance issue and the management of balance issues in geriatric population especially. And the fifth session, it was conducted on the afternoon. It was chaired by Dr. Chandramohan sir itself, and the speaker was Dr. Mohammed Yasir on the topic of inflammation, redox, balance, and effects of self-management exercise in knee osteoarthritis. It was a really in-depth knowledge that he have shared us. And the sixth session, it was chaired by Manisha Erati madam, and the speaker was Shyam Krishnan Kesar. The topic degenerative joint disease in elderly population. And the seventh session we had chaired by Dr. Annie Thomas, and the speaker was Dr. Ajimsha MS on the topic critical acute geriatric care and a PT perspective. And the eighth session we had Professor A. Shiva Shanmugam, and it was the speaker by Dr. Sanjay Ethan Samuel sir on the topic extended care for older population. So that was about the yesterday's topics, what all we have covered. And we have even conducted an e-posture competition. The winners will be announced soon. And today we have started with first topic, Dr. Manoj Abraham sir, chairperson. And the speaker was Dr. Sheetal Raj. She covered in multiple comorbidities and polypharmacy in older adults. She explained us about very in detail about the lacunae that is present in healthcare system and about polypharmacy, and also about the various solutions where we can make our impact on the care. And the second topic was chaired by Professor Nishad PB, and the speaker was Dr. Vijay Selvan.
Madam, kindly unmute.
Sorry, sir. The second topic was chaired by Professor Nishad PB, and the speaker was Dr. Vijay Selvan Natarajan, sir. On the topic Infinity Walk, talk the walk, the pinnacle stone leaves turn.
Madam, again, it got muted.
Sorry. So he explained us about the figure of 8 walk and the importance. We may have heard of that figure of 8 walk in our daily life and through various Google sessions and reports like that. But I really don't know the importance and the story behind or the importance behind the figure of 8 walk. So to know that, it was really enlightening. So he also explained us about what are the various measurements, other exercises to incorporate while doing the figure of 8 walk. And the third session, it was chaired by Ms. Vaishali Srijit Madam. The speaker was Dr. Rajisha T.R. on the topic urinary incontinence in older women. It is a very relevant topic that is a very common problem among the geriatric population, I must say. So she has a
Madam, kindly unmute.
She has explained us about the various impact of stress incontinence in geriatric population and risk factors and symptoms and possible physiotherapy treatment we can give for those older adults. And the fourth topic, it was shared by Professor Anthony Suresh, and it was the resource person was Professor Anila Paul, Madam. The topic need and scope of geriatric physiotherapy. So she has enlightened us about the importance of healthy aging and the barriers and challenges we may face while treating the geriatric population. She has also enlightened us with the various research aspects of geriatric physiotherapy. And the last session, fifth session for today, was chaired by Professor Saji Vitti Madam, and the speaker was Shyam Krishnan sir. He has enlightened us with geroscience. Like he said, it was the first time I'm hearing that word itself. So it was truly enlightening, and he started from the basic, and he explained us in detail about geroscience and what is gerontology and the various areas of aging research and interventional approaches we can make in geriatric population. So that is a summary about, we also have conducted e-paper session in the afternoon session, and the winners will be announced soon. And once again, I would like to take this opportunity to express my gratitude and love, especially for Dr. Chandramohan sir and Dr. Magesh Babu sir and Yuna madam on behalf of Sri Anjaney College of Paramedical Science, and from personally my side, to thank one and all the person on and off the screen to making this event a great success. Thank you.
Thank you, ma'am.
Thank you, madam. Thank you, Arama madam. Thank you, Arnima madam, for
Thank you,
handling for
sir.
these 2 days. Yes,
Thank you, sir.
yes, madam. And I request participants, those who are watching in YouTube, can join now through Zoom meeting. The Zoom link is posted in the WhatsApp group. Those who are watching there can kindly join here also. And also, I request our dignitaries here, those who are present, to give us the honest feedback about these events. And just before someone raising hands, I would like to call. Let me check where. Checking for Subramaniam sir. And also I have sent a link for Alirani sir. So I'm waiting for them. If they are there, then we can call. Sir Mahesh sir is chairman, sir available? Mr. Anil Kumar sir available? Yes, it's okay, sir. Let them join. And I request Annie madam, kindly give us a honest feedback. Then Glasson sir is there. Kindly give us the feedback, sir. How was the program for these 2 days? And Shiny Wide is there, a participant. And you can also give us the feedback. Annie madam?
Yes, Chandramohan.
Yes, madam. I saw you there.
Okay. Chandramohan, as I said in the beginning, it was a wonderful program organized by Anjanaya College, Professor Mahesh Babu and Chandramohan and team, Duna and Rupesh. I know you are being doing webinars. I have done GoviCon, COSCON. So
Yes,
I know this also will be a success. And this was a very good idea because everyone was concentrating especially on CoviCon, in the sense COVID and some general topics which may include what to say, it's a mix kind of thing, but this is very exclusive. And nowadays the present students, if you see, the PG students are more interested in doing geriatric care. Even I have come across many of them, and they showed their interest towards the geriatric care and geriatric physiotherapy. Even some of them have inquired where we can do PG program and all. But so I think it was the right time for your team to organize this thing, so that they also will get a feedback as such what is geriatric physiotherapy or geriatric care. Rather than thinking of the scope or anything, they literally might have understood what is meant for geriatric care. It is not only a nursing care or something. What a physio can do in the field of geriatric care is very well planned and organized, and all of the speakers were excellent. I think I missed only one or two, but rest of the speakers I could listen, and I have, even as a physio professional, I have learned many new things from this conference, and also feel like I should do more. That's as a professional itself, I got that encouragement to do something more, rather than sticking on our specialization, or rather than sticking on only to that area, we should think something else. Especially the last session of Dr. Sham was very much enlightening for me, because I felt, see, this somewhere I missed. I should think of this also. So everyone, Vanessa's topic also, like spine and spinal surgeries. I have seen many cases, but much beyond that, we have learned many things. Dr. Ajim Shah's topic, Sanjay Pensa's topic, all this was very, I'm just specifically saying one or two names, doesn't mean that others are not done. Everybody has done. Even our physician, Dr. Sheetal Raj. That topic also was like something like which many of them were missed to have a comprehensive view on geriatric care, which enlighten on that topic. So it was very useful as a professional. So I know definitely the students and clinicians and academicians also would definitely would have got encouraged from many topics from this conference. And it was very well organized.
Conference.
I think what to say, even other conference we used to feel many times the network issues and all. I think that also was very much reduced in this conference, right, Chandramohan? I
Yes,
feel this
madam.
was, it was very
Yes.
well organized. Only a little bit delay might have happened. That happens even in physical conference. It's there in all conference. So it was very good. And thank you. I think you should do much more. You should
Yes, madam.
think of like these areas which nobody is thinking, which will be very helpful rather than a normal some international conference. This kind of things will be very much helpful for everyone. So thank you, and congratulations for the entire team, especially those who have done MC work, those who have done the e-poster work, everything. So I am very much thankful for giving this opportunity by Chandramohan and team and Professor Magesh Babu. Thank you so much, and all the best for the next new venture. Thank you.
Thank you. Thank you, madam. Thank you so
ma'am.
much, madam. Gladson, sir.
Yeah, very good evening to one and all. It's my pleasure to give some feedback which I have seen these 2 days. Even though I couldn't attend most of the speeches that deliveries and all, but I could say that it is a wonderful e-conference which you have made. It is because of the coordination and cooperation in the team which made it in a grand success. Even though some of the people were little scared of coming forward, but they used the opportunity in a very good manner. We have the confidence on Dr. Chandramohan because he has the ability and he is conducting this program for so many times, and he is very expert in conducting such programs. So no doubt in that one. But when you see the colleges, to cooperate with that one is a little difficult because it is the first time for them. During COVID situation, it brought a lot of teaching to all the people, not only the physios, not only the healthcare people, everybody involved in webinars, e-conferences, and meeting all the people through the media. So it's a very wonderful sessions which we had. And when coming to the GERICON, I'm very much interested in geriatrics because my PhD topic also belongs to that only, institutionalized elderly, and it is about the psychological issues and the psychophysiotherapy aspect of it. So I am totally interested in this GERICON. Then one more point I wanted to tell about the university, the MGR Medical University, where separate specialties there in the MBT program. When we were in 2010 in the BOS, we framed a syllabus exclusively for geriatric physiotherapy. It is a separate specialty in MGR University. In other Meenakshi also it had. Those who have completed geriatric physiotherapy, they are in the higher levels in abroad. In India, it is not been much concentrated, but the people are posted in the old age homes. The issue is they are scared of treating the old age people because they may get the negligence that we can see. And how to tackle the geriatric people, it is a question mark. When we had the postings over there in old age home also, students asked us, sir, they are not cooperating. We said that you have to cooperate. It is not the matter of they have to cooperate, because we are physios going to treat them. We have to assess them. We have to take the planning and all. So we have to cooperate with them. We should have the patience. That patience will come when we practice by doing the skillful movements which is needed to handle the geriatric people. And when I see this conference, which has given a lot of inputs to so many people, those who are not putting their hidden talents outside. I could see the talents of different people, even though they were unable to come out due to some fences which they put in front of them. Now they know how to break down the fences around them and coming out and showing their talents. I have seen all the talents of different new people over here. I should thank the college, Dr. Magesh Babu. I am very closely associated with him. Most of the times we used to discuss with so many matters. So it's a very wonderful opportunity for me to talk about him also. And the team, my student, as you know, Dr. Arunima and her team members. They have done a wonderful job. I could see how their personality improved a lot through this e-conference itself, I could say.
Thank you so much.
So I thank Dr. Chandramohan for providing such wonderful opportunity to all the physios. Previously, I don't know much about you. I have put up in our physio forum also, and you could see some of the experts, they are doing their improvements through WhatsApp group itself. So we could see so many people through the WhatsApp group. I thank each and everyone who involved in front and at the back to make it a successful one. Thank you very much. Okay.
Thank you.
Thank you, sir. Thank you.
Thank you so much, sir.
Thank you so much, sir. Yes, what you have said is right, that academic college coming forward to join with us and doing such kind of activities, it is a difficult situation. But Mahesh sir took the risk, and when he said, okay, then immediately we framed everything. And we have got a wonderful support from Anjaneya College faculties. So unless until without their support, it is not at all a success this much. And thank you for your kind words towards us. And I request Professor and Dr. Vijay Selvan here to come forward, please, sir. Vijay, sir?
Yes.
Yes, sir.
Good afternoon.
You are speaker and you are always a well-wisher for us, and you must give your honest opinion about these 2 days conference.
Yeah. Good evening, all. It was a wonderful 2 days of program. It was like a relay. It was like a relay marathon. So you can call it as a relay marathon, starting from yesterday morning, going on till now. All the speakers have done extraordinarily well, and all the topics were exclusively dealt with and in a very appropriate way. And very happy for it. I congratulate all the team members, Chandramohan sir, Duna madam, and Magesh Babu sir, Danny sir, and Gladin sir, the whole entire team. I congratulate them on this particular occasion. And as you all know very well, so in according to the census, recent census, there are nearly 138 million geriatric population in India in 2021, according to the stats. And they say that by the year 2050, we the speakers will also enter into the geriatric population. By the year 2050, it is going to increase threefold. It is going to be around more than 300 million geriatric population. So the amount of people who is required to cater to the needs of these particular geriatric population is also enormously is going to be increased. As Gladin sir said in the previous talk, that geriatric medicine was a specialty in MPT in Dr. MGR University in Chennai, Tamil Nadu. It is a very booming field. When you take as the overall ranking throughout the world, the first rank in geriatric population is being held by China. The next, we are holding the rank. We are in the rank 2. We are in the second rank among the geriatric population, according to the count. So it is highly imperative and important to cater to various problems that the geriatric population faces. And I think this GERICON is the eye opener for the 2050 geriatric population, which is going to exponentially increase in India. And as you all are well aware that in abroad, especially in Singapore and other Southeast Asian countries, there are more number of care homes, caregiving homes, elderly homes, where more amount of physiotherapists are being employed, especially. So in Singapore, there are more than 1,000 vacancies are being open every year, especially to cater to the needs of the geriatric population. So that much importance it has. Many of our speakers who are right now here, we are going to fall into that category in 2050. So we should do something for the geriatric population, which are at present in 2021. So it was a well-organized conference. Thank you. As usual, the whole team, Rob, both the team of Anjaneya College of Paramedical Sciences and ExRxIndia prescription, they have done a meticulous job in bringing this program to an very good conclusion and giving more insights to all the public and the dignitaries who were present throughout these 2 days of the program. Thank you. Thank you once again.
Thank you, sir. Thank you so much. I request Anjaneya faculties to help Duna madam regarding a topic. Kindly type and send it. She is making a PPT
We
to
are
present.
making, sir. We are making.
Yes, thank you. Thank you, madam. And I know we all are attentive towards our screen.
Yes,
maybe, yeah, that's why I'm announcing here. And I request Assistant Professor Himani, kindly give us your valuable opinion towards the conference.
Good evening, sir. Am I audible?
Yes, madam.
Sir, actually 2 days international conference was really very nice. My student had participated for the e-poster presentation. They were so much thankful to me for that, madam, we got such a wonderful opportunity on an international platform. And all thanks to you, Dr. Chandra Mohan sir, for giving us such opportunities. As we have worked together for an international webinar on 16 July, I also had presented internationally. But these are the things we are looking forward, sir, for such conferences, for such speeches. So thank you, all of you. We heard all the speakers. We had got such a wonderful experience from all the things. Thank you so much, sir.
Thank you, madam. I call upon Dr. Vishnu Vardhan, Principal.
Hello, sir.
Welcome back, Mahesh, sir.
Not principal, sir. I'm just professor.
Yeah. Yes, sir. Please carry on.
Yes, sir. Actually, I was
in the
not
profile we have searched, sir. That's why.
Yeah, I would like to thank Chandramohan sir for giving me an opportunity as I was one of the jury members. It was not my specialization, but it was indeed like a knowledge sharing. I had a good experience, sir. And Chandramohan sir is like IPL. He brings talents. That's what I feel. He is like giving opportunities. So like IPL, how they give opportunities to youngsters and others. I think thank you for giving opportunity to all the teaching staff, sir. Thanks a lot, sir. And it was a well-organized conference. And thanks to team ExRx and Anjaneya College. Thank you, sir.
Thank you, sir. Thank you, sir. And over to Mahesh, sir. Kindly check with chairman if he is there. And kindly invite principals from the Kerala colleges who are present here, sir. Please check there is a participant list here and you can invite them, sir. And thank you, Himani, madam. Everything happened because of the support from Anjaneya College. And we are so much thankful to them. Sir, you are not audible, sir, Mahesh, sir. And I must say that Danny sir's support also from the day we have planned. He was there with us. And thank you, Danny sir, for that. And I request anyone come forward and give honest feedbacks? Anyone? Speakers, if they are there, chairpersons, guests, participants, please come forward. Yes, sir. Yes, waiting for you. You are there.
Sir, can you hear me, sir? No?
Yes, sir. I hear you now.
Okay, sir. Okay. I think Anila, madam. Are you online, madam?
She was there, like, she is not seen now.
Yasir, sir, there. Sir? Mohammed Yasir, sir.
Yes, sir. Kindly take 2 minutes from your busy schedule and give us your valuable feedback.
Yeah, thank you, Dr. Chandramohan. I'm just driving on a long drive from the work. Yeah.
Okay.
So I may not be audible sometimes, so please excuse me on that one. Yeah, and it is I'm really thankful to Dr. Chandramohan for inviting me as a speaker, and I could share what couple of points which is relevant to the present scenario. And it is indeed a great honor for colleges like this to participate in such kind of activities so that it will enlighten the students as well as the faculty members to come forward. So as everyone knows, Dr. Chandramohan is really a backbone for all these kind of activities. And I'm happy to get associated with the entire team. Thank you so much, and all the best to you.
Yes, sir. Thank you, sir. Thank you so much.
Thank you, sir. I call upon Saida. Saida from Mountain Point.
Hello, can you hear me, sir?
Yes, Saida, yeah.
Yes, sir. A warm good evening to one and all. It was my pleasure to be part of this conference, and I did learn many things from 2 days. So among this, I also learned the real-time, not only the basics, but also the upgraded versions of rehabilitation in geriatrics. And I also felt that I should also be updated much about geriatric cases. So it was very nice conference. Thanks a lot for everybody's role play in this. Thank you so much, sir, for giving us an opportunity to be as participants and also involving all of us. Thank you.
Thank you, Saida.
Yes, sir.
Any of your students are there, Saida? Did them give you any feedback?
I think yes, sir. I'll just check over.
And from students, participants, can we have Harshika Gupta, Harshita Mittal? Yes, before we move on to them, Shiny White, Dr. Shiny White from Indore.
Yes, sir.
Yes, please. You were there from
Yes, sir.
yesterday,
Yes, sir.
continuously
Yes, sir.
there. Yeah, give us
Yes,
your
sir.
feedback.
First of all, very good evening to everyone. And I am very happy to attend this 2 days conference. And it was excellent throughout. That was an eye-opener for the students and the freshers as well. I believe the neurons got fired up and bombarded with the new spectrum and scopes. I thank Anjanya College and the team ExRxIndia, Dr. Chandramohan sir, Dr. Rupesh sir, Duna madam. I congratulate them that the event was very successful and fruitful throughout. And we got new topics regarding research, like the assessment part, the exercises protocol, the advanced versions of all. And my favorite was Infinity Walk. Geriatrics is a very crucial subject these days and need of the hour for the society and the nation as a whole. I congratulate every participant and the team members of it. Thank you so much.
Thank you, madam. Nahesh sir, would you like to call anyone? You can check the list, sir, the participants list, please.
Anjana UM. Anjana, unmute yourself. Can you give any feedback? Or Vibhuti Joshi?
Yes, sir. Yes, sir. Yes, sir.
Yeah, you can give any feedback about the program.
Thank you, sir. Thank you, Chandra Mohan sir, Tuna ma'am, for giving this opportunity. And it's very wonderful and very fruitful and informative session for us. So thank you so much to ExRx team. Thank you so much to Chandra Mohan sir and Dunna ma'am. Thank you, sir.
Thank you. All happened because of Anjaneya College of Paramedical Sciences support and Mahesh Babu sir's effort. Kind support made us this conference successful. And we would like to have one or two more only so that we can move on to the next program.
Ramya madam from Limsa Angamali, principal, teacher flower is here. Would you like to express some opinion, ma'am?
Yeah, good evening, everyone. Thank you for inviting me for this event. It was really a wonderful event. It was opened a new perspective, I think. Geriatrics was a bit neglected part, and this was an eye-opener too. I hope in our university too, we can start the geriatrics as an MPT specialty, because it is having a wide scope, and all the programs were, or the presentations were keeping high standard. You have selected wonderful speakers, and I'm thanking you for this. And I am personally, I'm congratulating Engineer College as well as the ExRxIndia, Dr. Chandra Mohan. I can't mention about the hard work of Mahesh sir and team behind this. They were continuously contacting all of us throughout. Mahesh sir, Dani sir, then Jasil sir, I don't know everybody's name. I am mentioning all the faculty members of Anjaneya. I am congratulating all of you, Donna ma'am, Dr. Aroma, everybody.
Thank you so much, ma'am.
Expecting more from ExRxIndia and Dr. Chandra Mohan and Anjaneya. Looking forward for the or future and new events. Thank you so much. Thank you for inviting me, and congratulations once again.
Thank you, madam. Thank you.
Thank you, madam. Thank you. Can we move on to the next program? Mahesh sir?
Yes, sir. Yeah.
Yes, sir. Okay. Duna madam? I would like to hear from students' side. Yes, I said. I forgot. Harshika Gupta and
Milind Dailai.
Yeah, Milind, Satya. Yes, they are there. You are there. Kindly give us, because the main thing is to reach you. It is difficult for us. And those who are already in academic side, they will have a lot of opportunities to get knowledge from different places. But being as a student, and you should convey your opinion.
Hello, is I audible, sir?
Yes, yes, Harshika.
First of all, I would love to wish to each and every present over here, all teachers and dignitaries, especially the Anjana College and the EXS team, which always continuously from pandemic till now, they give us a great opportunities and lots of like not just a opportunity to participate, even a learn after without the conferences like a sessions like a student by the for the student by the student program, and lots of the sessions which are provided like free sessions, free lectures, even for the those who are going to attend in that Sabnitar competition. They have also get the free opportunity to get learned because of this pandemic. The financial crisis are there, and the of course the like a problem faces, they are not can't move for the coachings. The this is the only platform which provides a lots of benefits by like in an education field. I think ऐसा कुछ भी नहीं है जो सर ने छोड़ा हो, जो पेंडेमिक में हमें जरूरत है सब कुछ प्रोवाइड कराया है सर ने, चाहे वो एक सेशन के थ्रू हो, चाहे वो एक कंपटीशन से रिलेटेड हो. And I, from my bottom of heart, I really would love to show my gratitude, to thanks, and of course, this opportunity means a lot for me, because in this pandemic, I get this opportunity third time to say thank you to you and this team. It's a great team. Actually, the Duna ma'am, Rupesh sir, and Chandmohan sir is a great team. I never saw this type of team and this type of work, a teamwork. So I learned a lot of things like how to deal with the team, how to manage the programs, because lots of situations I can I can feel that lots of problems are facing, but still never Chandramohan sir and his team never feeling, I never saw that they are tired, but still it's background things. So but I can feel that how you are enthusiastic. So I learned that how being always keep continuing and do the work in a good way. Thank you so much, sir, for providing this opportunity. Thanks a lot.
Thank you, madam. Last time, Balaji College of Physiotherapy supported us so that we had a QuestCon. You were there also. Before that, on CoviCon also, you were there. And this time, Anjaneya College extended a wonderful support. In fact, we got more participants than QuestCon. We are very happy about it. That much hard work Mahesh Babu sir has put, and it has brought more than 250 members to come together for this program. And
Can I add
thank
a few
once
things,
again
sir?
for Mahesh. And yes, madam.
What I feel from Harsika's voice is that she is a lot emotional for us too.
Yes.
And this love actually binds us together. It is the cement that binds us together as a team to work on. And from that, actually, we get the energy. Thank you so much.
Thanks.
Hashika, are you okay?
Yeah, ma'am. Actually, it's I can't express the things which means a lot for me, and this opportunity is like for me in this pandemic situation. I can always searching the platforms, but when I met to you and your team, I feel that I have no need to do the task or work, especially for searching the platform, because you always ready. And when I am thinking, I think the platform will come in front of me.
Thank you so much, Harshika.
Thank you.
Yeah, please carry on, Chandramohan sir. I have just interrupted you.
We can move on to the Yes. Kindly handle them. Yes, please. Yes. Can we move on to prize announcement and valedictory function, Magesh sir?
Yes, sir. Yeah, definitely.
Yeah. Over to MC team. And yes. Prize announcement by Duna madam. And before we
Sir,
say the
can we
prize,
request Makesh sir to do that?
yes,
It will be better.
yes.
Makesh sir, the whole team GERICON will be like to request you, so you can please announce the results. First, we can go for the e-poster presentation competition, and we will be going according to the categories. First, we will be announcing for the UG category.
So the details are in WhatsApp, sir. Kindly check our SACPMS.
Sir, you are not
WhatsApp
audible,
group.
I think, Makesh sir.
Can you hear me, madam?
Yes, we can hear you now.
And while Sarah is searching for the message.
Yeah. Very good evening to all. Just related to the e-paper UG category, the first place go to Harshika Gupta. The topic was Geriatric Population Framework and Planning COVID-19, a literature review.
Kindly.
Harshika, claps for you.
Thank you so much.
Congratulations.
Thanks a lot.
And certificate will be issued later, Harshika.
Yeah, I will
Okay.
try
We are
to
working
prepare
on
it
it.
soon.
And
So
for
much.
the e-paper PG category, first place goes to Akila K. Effect of Potago exercise program and Bosu ball exercise in balance impaired younger older adults.
Congratulations,
there?
Akila K.
Yeah.
And giving hands for her. And the second place goes to Sajita KU. The topic is effectiveness of Potago exercise program in reducing falls in elderly living in old age home. Congratulations, Sajita. And the third place goes to Mahinsa CP. And the title is Effect of Worksite Physical Therapy Intervention on Neck Pain Among Office Workers. Congratulations, Mahinsa. And for the professional category, the first place goes to Ginny Dominic. The title is Efficacy of Task-Oriented Motor Training versus Multisensory Training on Gait, Balance and Quality of Life in participants with type 2 diabetic neuropathy. Congratulations, madam. And the second place goes to Nupur Kulkarni. The title is Impact of Group Exercise Program on Fall Risk in Elderly Individuals, a randomized controlled trial. Congratulations, Nupur. And now we would like to announce for the e-poster category. For the UG category, the first place goes to Harshika Gupta, and the title is Recovery Map for Geriatric in COVID-19, a review. Congratulations.
Thank you so much. Thank you so much once again, sir.
And the second place goes to Kajal Bodwani, and the topic is Physiotherapy in Older Adults for COVID patients. Congratulations, Kajal. And the third place go to Harshita Mittal, and the topic is Improved Balance Confidence in Older Adults. Congratulations, Harshita Mittal. And for the PG category, the first place go to Akhil S. The topic is the efficacy of cross 3-dimensional exercise therapy in the treatment of idiopathic thoracic scoliosis, a case study.
Thank you very much, sir. Thank you.
Congratulations, Akhil. And the second place goes to Toral J. Wajah. The topic is effectiveness of perturbation-based balance training to reduce risk of falls among elderly people, a literature review. Congratulations, Toral. And third place goes to Shreya P. Sethi. Effect Y-fit exercise on balancing older adults, a literature review. This is the topic. Congratulations, Shreya. And for the professional category, the first place goes to Crystolite, the clinical assessment of sarcopenia in hip fracture persons among elderly. This is the topic. Congratulations, Crystolite.
Thank you, sir. Thank you.
And the second place goes to Milind Kahle, and the topic is prevalence of osteoarthritis of knee in underground coal mine workers. Congratulations, Milind. And the third place goes to Himani Parekh, and the topic is physiotherapy care for geriatric community during incontinence. Congratulations, Himani.
Thank you, sir.
Thank you so much, Magesh Babu sir. And as we promised that in e-paper category, those who got first place, their papers will be published in Index Journal. And for many of other participants, especially to belongs to Kerala and all those things, we waived off the fee for first author, and even for others we have waived off second author, third author free. So we waived off the price amount also. So we repeat that, as we waived off second author, third author fee, and for colleges students from Kerala, we waived off first author fee also. So we waived off the prize money. But as we promised, we will be publishing your papers in an indexed journal. And
the thing, they will be getting the winner's certificate.
yeah, there will be certificate. And the next is first certificate, madam, for
Yes,
guest
sir.
speakers and all those things.
Sure, sir. I will be requesting for screen sharing.
Yes, madam. Should I do that? I think
No,
welcome, Rupesh.
I'll be doing that. I have to show the certificates, no, sir.
And really, with the help of the ExRx and all my faculty, we have done a very nice job, and we have conducted a wonderful 2 days conference. And I would like to thank ExRx India, Dr. Chandramohan, Dona Madam, and Rupesh sir, and all my faculty, everyone. Thank you.
Yes,
Sir,
yes,
is my
yes, sir.
screen
We will
visible?
call you,
Thank
sir.
you,
We
thank
will
you,
call
Mukesh, sir.
Yes,
We will call you, sir, to speak. Yes, sir. And for the guests now,
Sir,
I
is
request,
my screen visible?
Yes, ma'am.
Yes,
Your screen is visible, ma'am.
we request Mr. Anil Kumar, sir. And yes, madam, just show. And I
Yes,
had a
sir, I'll
chat
be
with Ali
opening
Rani,
it.
sir, that he couldn't connect because he got the flight, I think. So it is difficult for him to join with us. But still, he
Sir,
was
can
with
you
us.
see in full screen?
Yes, madam.
Yes, madam. We can.
And the certificate goes to Chairman, Malabar Medical College Hospital and Research Center, Mr. Anil Kumar V, for the wonderful support. Because yesterday we had electricity problem in Anjaneya College, and he provided continuous generator support to utilize it, and Wi-Fi support for College of Physiotherapy to stay connected throughout the program. Thank you so much, Mr. Anil Kumar, sir, for your wonderful support. And yes, it is a successful program with all your blessings.
I'm going for the next one.
Next. And yes, 63 years young man.
Sir.
And Professor Dr. Ali Irani for his wonderful support by sending all of his MPT students to attend this India's first ever 2 days Geriatric Physiotherapy Conference, GERICON. Thank you, Professor Dr. Ali Irani. And we can move on to our distinguished guests.
Kindly wait, sir. I will be opening the files.
And yes, from QuestCon, not only from QuestCon, even before webinars, Dr. S.S. Subramaniam is huge support, gives us a huge support for everything we do. And there was a wonderful, successful event, QuestCon, earlier. And now with the help of Mahesh Babu, sir, we are having a successful celebration now. And thank you, sir, Subramaniam, sir, for supporting us always. And we will be sending the certificate to you through mail. And Savita, madam, I think I also requested, kindly check whether she's there once. She
I cannot check at this moment, sir.
Yeah. Okay, she's not there. And thank you, Savita, madam, also for a wonderful support towards all the academic activities we are doing. And yes, madam, Duna, madam, we can move on to the next.
Okay. Can you see my screen?
It was having
Something stuck in.
Yes. Actually, I by mistakenly pressed the switch on off button. Sorry for that.
Okay, you will get disconnected.
No. I'm okay. It was just went to sleep mode.
And always,
Narasimhan
sir is like, Professor Narasimhan is like, when there is any academic, at any time you call me, anytime, and I will be there. And yes, he was there for QuestCon, and he was there for CoviCon, and he was yesterday he was there as a guest to bless us. Thank you, Professor Narasimhan, sir, for your support. And Vijay Kumar
Yes,
sir
sir.
from Dayanand Sagar College of Physiotherapy, my senior. And yes, thank you, Vijay Kumar sir. And here the certificate is there. We will be sending you through mail. And
Nishana, ma'am.
Nishana madam, and she is also a wonderful supporter. And we missed you in this because we selected mainly from different categories. So next time we will take you in for the conference. That's why we called you as a guest for this time. So thank you, Nishana madam.
Congrats, sir.
Thank you, Kamraj sir, Principal, AKG Cooperative Institute of Health Sciences, for the support. And thank you, Srijit Nambudri sir, President, IAP Kerala, for your presence during the inaugural session. Thank you very much. And lastly, in the list,
Also, not the
yes,
last.
Kumar. Yeah, yeah.
One more there.
And thank you, Gokumar sir, President, KAPC. Thank you for your support.
One more there.
Yes, I should say some words regarding her. Thank you so much, Sheetal Raj madam, being a physician, finding time to make PPT for 2 sessions. It is not an easy job. And even when requested to be one among our guests during inaugural function, you agreed for that. Thank you so much. And I thank Shyam Krishnan sir for suggesting me to reach Dr. Sheetal Raj this time. Thank you. Thank you, Sheetal madam. Then to
So here we are
chairperson.
ending the guest lists.
Yes. Over to Magesh Babu sir. You can go through name by name, sir.
Yes, sir.
Sir, kindly request the chairpersons to receive the certificates on behalf of Team GERICON.
Okay. Dr. P. Satya, and she is Associate Professor and Head, Department of Kinesiotherapy and Physical Diagnosis, DY Patil, deemed to be University Nerul, Navi Mumbai, and she is my senior in my UG. So I am very happy to invite her as a chairperson.
Thank you, sir.
Yes.
Moving towards the next one. Sir is present with us.
Yes, Professor Dr. Gladson Joseph, and he is the principal of M.E. City College of Physiotherapy, Mangalore, Dakshin Kannada, Karnataka, India. And we are associated for a very long time, and we'll be very close, and all these things we will be keep on discussing professionally. Thank you very much, sir. And Professor Ramya Nilambaran, Madam, Head of the Department of Physiotherapy, Little Flower Institute of Medical Sciences and Research, Angamali, Ernakulam. And I have associated with the Madam from 2014, and they are very close, and we will be going for the evaluation and exams, everything. And I am very happy to be associated with Ramya, Madam. Thank you for your kind support for the conference, Madam. Thank you. Yeah, Dr. Jibu George Varghese, and he is the Chief Inspector and Senior Consultant, Revival Institute of Manual Therapy, Chennai, India. And also he was previously working in Sri Ramachandra Medical College and Research Institute, deemed University, Chennai. And actually I did my PG there. Completed in
Dear
2001.
participants, kindly keep muted.
And he was there in Sabita University also, and after that he was there in the Morgan University. Currently he is there in Revival Institute. So I'm very glad to be associated with him. Thank you, Dr. Zibu sir.
Yes, sir. Going for the next one.
And Dr. Manisha Irati, Madam, She is a professor in Department of Community Physiotherapy at the D.Y. Patil College of Physiotherapy, Pimpri, Pune, and she is very knowledgeable and vast experiences she is having, and a lot of research work she had done. So we are very happy to be there for the chairperson. And Professor A. Sivasanmugam, he's from Bethany Navajan College of Physiotherapy, Nalanjira, Trivandrum, Kerala, India. And he's also associated with me from 2015. And actually, he's junior to Dr. Chandramohan sir in the, I think, UG. So we are very happy to invite him as the chairperson.
Yes, sir. Not only Professor Sivashanmugam, and also one topic we have missed, Prabha Mohan Kumar. She is also my junior during my UG days. And I am also happy to see them again after long years. Thanks for calling Professor Shanmugam for this event, sir. I was surprised.
Okay. And Dr. Manoj Abraham M., Professor and Principal KG College of Physiotherapy, Coimbatore, Tamil Nadu, India. I was associated with him from 2002 when we were working in PhD College of Physiotherapy, Coimbatore. And after that, he was working in various places. And he was there in Malaysia also. And he was earlier principal in Savitha University, Chennai, Tamil Nadu also. And currently, he is in KG College of Physiotherapy as professor and principal. And I was very happy to make him as a chairperson. Thank you, sir, Manoj, sir. And Dr. Annie Thomas, madam, neuroscience physiotherapist and director, physiocare and research coordinator, School of Health Sciences, Garden City University. When madam was there in St. John's itself, I have association with madam. And now, currently, I am doing a PhD in Garden City University, and madam is the director there. We are very happy to be calling you as the chairperson as well as the resource person, madam. Annie, madam, thank you, madam.
Thank you, Mahesh Babu, sir.
Yeah, thank you, ma'am, for being here.
Thank you, Duna ma'am.
And Professor Nishant PD, and he is the head of the Department of Physiotherapy and AWH Special College, Kalai, Kozhikode, India. And I have been associated with him from 2015, and he is a very good supporter of us. And I am very happy to call him as the chairperson for this conference. Thank you, Professor Nishant, sir. Professor Vaisali Srijit, and she is working as Vice Principal, Dr. M.V. City College of Physiotherapy, Mangalore, Karnataka, India. And she is also the chairperson, Board of Studies for UG in the Rajiv Gandhi University of Health Sciences, Bangalore, India. And I have been associated with her also from 2015. She was previously working in Bethany Navajan College of Physiotherapy, Trivandrum. Currently, she is working in Dr. M.V. City. We are happy to call her as a chairperson for this session in the conference. So thank you, Professor Vaisali, madam. Yeah, and Professor Anjali Suresh, madam, she is the head of the department Physiotherapy, Garden City University, Bangalore, Karnataka, India. And I have been associated with madam from 2013. Actually, I was the internal examiner and madam was the external examiner for one of the PG exam. And currently, madam also yet to complete the PhD in Garden City University. And she is also my course coordinator. Thank you, Professor Anjali Suresh, madam, for being the chairperson. Thank you. And Professor Saji Madam is currently the principal, Cooperative Institute of Health Sciences, Talaseri, Kannur, Kerala, India. And with Madam also, I'm associated from 2015. And we are very happy to be calling you as the chairperson for sharing this session, Madam. Thank you for Professor Saji Madam. And she is also given very good support for our conference.
Yes. Thank you, sir. Thank you, Mukesh sir, too. Here we are ending certification for the chairpersons. Next, we will be moving to the e-poster juries. May I request Chandramohan sir to announce?
No, madam. Yes, yes. Three members. Yes, yes. Speakers, I thought. Okay.
E-poster juries, sir.
Yeah. Okay.
Would you like to please announce the certification?
Yes, madam. Mahesh Babu sir, kindly announce.
Okay. Yes, sir. Please continue. He was continuously speaking, so I just requested you. Just an alteration.
And Dr. Vinod Kumar KC, MPT and PhD scholar, Associate Professor, College of Physiotherapy, School of Allied Health Sciences, Dayanand Sagar University, Bangalore, Karnataka, India. And actually, he is my colleague in 2013 when we are working in Oxford College of Physiotherapy, Bangalore. And currently, he is there in the Dayanand Sagar University. I am very happy to call him as a jury for the e-poster presentation. Thank you for your support, Dr. Vinod Kumar sir. Thank you.
Yes, sir. Let me carry on this one. And yes, Pushpendra Yadwanshi sir for HOD. He's working in Career Point University. I think his students also has got one of the prize here. He's always a very good support. Whenever we need help, we reach them and immediately he says, yes, thank you, Pushpendra sir, for being one among the jury member for the poster presentation. And Nancy Madam, she is also through Nancy Madam only I got to know Shyam sir, and thank you Nancy Madam for supporting many of our academic events and also for this poster presentation being a jury member. Yes, Madam.
So here we are ending the e-poster jury member certification. Next, we will be moving towards paper presentation jury.
Yes, here I have to say, before the conference itself, Dr. Arun Balasubramaniam was the one. You should do something next, and he is also one among the reason behind this GERICON. So I'm happy that he was one among the jury, and he guides me in many of the things to like this and approach that, and he made me to talk with many of the college principals by providing wonderful support for many events. And thank you so much, Arun Balasubramaniam sir, for being even in fact, when we have any ideas about, sir, what are all the criteria for poster or paper, immediately we will reach to 2-3 persons. One is Arun Balasubramaniam sir, and another one is Annie Madam. And they were like, any minute they will make the work and they will send it through mail. Just we need to forward it to our judges or members who has it. That much help they are also doing it, even though they are very smallest help, but it makes us to feel very ease, no tension at all. That thank you.
Yes, sir. I am back.
Yes, madam. Yeah. And Sri Hari sir, yes, we knew him recently through Dr. Vijay Kumar sir. Thanks for accepting our invitation, Sri Hari sir, and for acting as a jury member in paper presentation. Yes, madam. And here goes Arun Balasubramaniam sir certificate. Yes. Thank you so much, Arun Balasubramaniam sir. Yes, madam.
He is the first one to send me that evaluation sheet at the right moment after closing the paper program.
Yes, he's very fast. Sometimes
yes.
We can see that he will
fast
speak.
And very efficient and perfect.
Yes, he will take webinar, but he will be chatting in the sense of answering someone's question in the chat box. But he will be speaking here. multi-talented, sir. Those who knew him very well,
they know it.
Yeah.
Yes, sir. I am
Dharman Vyas, very young chap, and yes, thank you, Dharman Vyas, for always associated with us. And yes, we are happy to have you as a jury member. And thanks for helping us at the right moment. And yes, Dr. Vishnuvardhan. When I approached him, he said, "Sir, I am not CBR." No, I said, "No, everyone should know everything. You must be there." And thanks for accepting the invitation.
Yes, sir. Thank you. Thank you for giving me this opportunity. A good platform for me, sir. Thank you, sir.
Welcome, sir. Welcome. And yes, we can now move on to speakers.
Yes.
Yes, thank you, Dr. Sheetal Raj, for the wonderful 2 sessions. Yes, it was really an eye-opener for many of us regarding medicine side and what we have to do, what is CGA. You have taken very nicely, and thank you for that.
This certificate is for comprehensive geriatric assessment, and the next one I will be showing right now. This one.
And for the another one more wonderful topic, multiple comorbidities and polypharmacy in older adults.
Thank you,
I think madam is not there, but okay, Shyam sir is there. If he is there, he can convey it.
Yes, sir, I'm here right now. I'll convey.
Yes, sir. Yes, thank you so much for suggesting me to reach Dr. Sheetal Raj.
Yeah,
and,
we work as a team, sir. We have a comprehensive geriatric clinic within KM.
Kindly accept her certificate on behalf of her.
Surely,
and
sir.
yes, we will be sending it through mail.
Sure, sir.
Thank you, sir. And thank you so much, Benil Pillai, sir. And apart from the topic, we all really like your voice first. So nice to hear you, making us all attentive. Kindly accept our certificate, sir. We will be sending it through mail, and we also request you to give us your feedback.
Is sir with us?
Yeah. Hi,
Yes,
I'm
yes.
with you guys. I'm with
Thank
you
you, sir.
guys.
Thank you.
Absolutely, it was a pleasure to be part of this event. It was wonderfully sketched down, and like I said, when you approached me last month and you said you want to do something on elderly, I was a bit skeptical. Should I be involved or not? Because this is not my area of work. But yeah, it would be nice. Then it would be an absolute privilege if we, who have been working for a few years ahead of the others who are budding therapists, and if we can share some information and some knowledge across, and if that helps them to grow into better therapists, why not? So yeah, that is the most important thing. And I again wholeheartedly congratulate you guys. You guys are doing an amazing job. And at any time, yeah, we can always do the best to get the field moving back in India. It would be always good for all of us. Again, thank you so much. Stay blessed.
Thank you so much, sir. I had a doubt that whether you could make it due to some other reasons, as you said earlier. But you made it, sir. Thank you so much.
Yeah, thank you.
Yes. And here certificate goes. It's like I'm taking the certificate. And Annie Madam is there with us for more than 1 year, and she has done a lot of webinars with us, and for almost all our major programs, she is there to support us, even if it is small work. She follows us. Have you done this, that, everything? A wonderful supporter of us. Thank you, Annie Madam.
Thank you, Chandramohan. It's all because you are trusting you have trust on me. That's why I can do the support. And thanks for this wonderful opportunity. Thanks for Makesh sir, and thanks for Chandramohan, Tuna, and Rupesh for giving this opportunity to give my knowledge, to share my knowledge. Thank you, and thanks to all the entire organizing team I told no the people who had done MC, those who had done e-poster. I missed e-poster this time, but I know you would have had a wonderful time.
Yes, madam.
It was it was very interesting. It was very good. All the speakers were excellent. Congratulations to everyone, and thanks to you.
Thank you, madam.
Sorry, I just got disconnected again. But I'm back.
Yeah, you are there, madam. Very much.
I hope anyone has accepted this.
Yes, yes.
Yes, Duna. Thank you.
Yeah, thank you, ma'am. One more thing I would like to add about you is like whenever Chandramohan sir says you, ma'am, say something about this. Give feedback to us. You are always ready to say something, and that is so much positive. I really feel very good about that, ma'am. Anytime you can speak something.
Yes, thank you.
And when I said Annie madam is agreed to do the topic, Mahesh sir was also happy. I know her. Yes, I had her name in my mind. You approached and said, well, you also approached her, no problem. And she never says no.
Thank you, sir.
Sir, kindly present this to Girish sir.
And Dr. Girish sir, thank you so much for your wonderful sessions. And yes, he is not there. He sent message. Thanks for the encouraging messages which I have received. We will be sending your certificate through mail, sir. And here comes Shyam Krishnan, sir. Kindly accept the certificate. There were some fans for you, sir, even though the topics were very lengthy. And I have received that Shyam Krishnan's lecture was very, very, very deep and good, knowledgeable session. And thanks for that. You have
this one is for the topic degenerative joint disease in elderly, and we are having another certificate for Shyam Krishnan sir. I'll be opening it.
Is there, sir? Shyam Krishnan sir there?
Shyam sir, are you there?
Yes, sir. Yes, I'm here. I'm
received, sir.
I'm just immensely happy to have been a part of this, and I really like. I just cannot appreciate your effort which has gone into doing this, in fact. And we don't have geriatric conferences in plenty, anyways. And on top of that, in this time to conduct a e-conference like this, and having given us this opportunity, it is wonderful. Thanks a lot, and I really hope we can cooperate in the future too. Probably in similar areas, definitely.
Yes, sir. I remember now those days where we have sat and discussed what have to be done, how to set the sequence. Thanks for all the help from your side.
Thank you, sir. Thank you. Thank you, sir.
On behalf of Anjaneya College also, I would like to thank you.
Thank you very much, sir.
Thank you, sir. Thank you.
Thank you, sir.
And yes, Sanjay Appan, sir, Principal, Lakshmi Memorial College of Physiotherapy. He always supports. From the COVICon, I have seen supporting all of the educational events and encouraging his students to participate in various events also. Thank you, Dr. Sanjay Appan Samal, sir. We will be sending you a certificate through mail. And Ajimsa, sir, you are there. Before receiving certificate, you should give us your feedback, sir.
Hello, good afternoon. Sorry for not being here today, because being a Sunday here is the first day of working, So
yes, sir.
We were so jammed here because of the many issues. When Dr. Chandramohan actually contacted me for the first time, that time I was in India for vacation, so I was not sure what is going to happen. And being not a geriatric person, when he invited me, then I thought what I will take. Then he actually guided me that we would like to have a topic in acute care. So being an administrative person here, what was the advantage that, I know how the things are happening here, because we actually introduce things here, like the geriatric pathways, stroke pathways, stroke community rehab pathways, like that. So I thought I'll just show some of our experiences in a way that even the graduates, undergraduates can understand how, the critical and acute care, the geriatrics people being respected and being taken care of. So this is the first time to my, like I used to be my area of core area is either fascia or the stroke, but first time I'm giving a talk on geriatrics. So thank you for offering that spark in me to have some topics. And I'm just was, sometimes I used to open the YouTube and I'm hearing the topics and all. Most of the topics were amazing. They are actually very updated, and the moderators, whatever, like the organizers, everything, it was like a collected beat. And what I felt was actually it could have been reached much in depth to much more people, so that like people should know more about the importance of such things. And the e-conference, what is the advantage? Anybody can hear from the home. So hopefully that this spark will go on, and people will appreciate more such type of events and keep doing these things. Our full support will be with you always. Actually, yesterday I was messaging Dr. Chandraman. He was like, I'm tired, but we were talking, we are chatting about our future plans even. I was so amazed with his energy level. Thank you for inviting me for this the program. Thank you.
Actually, you should thank Magesh Babu sir. He only reached through me. I really don't know a person called Ajim Shah. I really don't know. Mahesh sir guided me actually. Sir, why don't you?
Actually, I want to tell at this juncture, Ajim Shah's details were given by Mr. Danny Verghese, Vice Principal, SACPMS.
Okay. So being here away from India, I don't have much connections now. So I was also stressing and thinking, who will be that person who has given my name to the list? But it was actually a surprise. Really a surprise. Thank you.
Thank you, Magesh Babu sir. Thank you so much for suggesting us to reach to Ajim Shah sir. His topic was wonderful. Thank you, Ajim Shah sir. We will be sending you a certificate through mail.
Thank you very much. Thank you.
And yes, Muhammad Yasir sir, are you there? He was there.
Dr. Chandra.
Yes. Sorry, yes. We welcome Professor and Dr. Ali Irani. He was in Dubai. He had some network issues. And welcome you, sir. Ali Irani, sir.
Thank you.
And sir, you can talk regarding geriatrics for 2 minutes. Unless until you talk about geriatrics, we are not giving you a certificate, sir. We got you after a difficulty.
Thank you, Dr. Chandramohan.
Yes, sir. Thanks for coming.
Good evening, everybody. I'm sorry that I could not be in the network on time because I'm traveling and not in India. I'm talking from UAE. I was almost 2 hours away from Dubai. Yesterday, we were speaking about geriatrics. So I said to the listeners once again, science is going to increase the longevity of a human being. We are all going to live longer. We are all going to cross 100. But there has to be a quality in us, the right muscle strength, the right range of movement, which is what only a physiotherapist can do. As I said earlier, a physician will add life to the years, but it's going to be the physiotherapist which will add quality of life to this number of years. So we are in a healing profession. Geriatrics is part and parcel of physiotherapy. We need to see that quadriceps muscles have enough strength to make us stand, sit, and walk or run. All our other muscles should be in order to be able to do activities of daily living. So physiotherapist has a very, very big and important role in geriatrics because science is going to increase the longevity of a human being. And definitely we all will be part and parcel of the new gyms coming up, calling it, whether you want to call it 60 plus, whether you want to call it senior citizen, or whether you want to call it a geriatrics gym. This gym will not be for bodybuilding. This gym will be for activities of daily living. everybody having their balance, the right strength to be able to wear their own clothes, to be able to go to the bathroom, take a bath by themselves, and do activities what they need to do. So it is another specialty, another feather in the cap of physiotherapists. And I'm thankful to Dr. Chandramohan and the whole team since yesterday being working on this. And I wish all of you all that God should give you all a healing hand. Thank you.
Sir, here is your certificate, sir, on behalf of Anjaneya College of Paramedical Sciences and the principal, sir, Dr. Mahesh Babu. We are presenting this certificate. I will send the certificate through email, sir.
Thank you. Thanks a lot.
And
thank you, Dr.
thank you
Mahesh
for
Babu.
wonderful.
Thank you for supporting the great cause. Thank you, Mahesh Babu.
Thank you, sir. Thank you.
And sir, I spoke with Mansi madam that you were ready to do some even for half an hour session also. We will be arranging for that. And geriatric
Sure, I will present. Well, I'm in Mumbai. Tomorrow morning, I'm in Mumbai. After that, anytime.
Anytime we will plan for that, sir. Yes,
Thank
even
you.
yesterday you were saying that. That's why I remember now. So we will do it, sir, very soon.
Thank you.
Thank you for marking your presence, sir. Thank you so much.
Thank you. God bless. Bye-bye.
Bye-bye, sir.
So
Yes.
going back for the speaker participant presentation.
Yes. Sorry, Yasi, sir. Yes, sir, there?
He was on travel, perhaps got disconnected, sir.
Yes, yes, yes.
Yeah,
All of a sudden.
not there in the meeting.
Yeah. Okay, he's not
Still,
seen.
please present.
Yeah. Mohammed Yazid, sir, thank you so much. I understand you are in the traveling. Yes, we will be sending the certificate to you. Thanks for the wonderful session, sir. And yes, Professor Dr. Vijay Selvan Natarajan, thank you so much for being with us for a longer duration, almost associated with the, when we started webinars. And thanks for suggesting this topic, and you have taken it wonderful. There were a lot of questions regarding this topic. On behalf of
So many
Anjaneya
questions and so many thank yous.
Paramedical Sciences and the ExRxIndia, we will be sending the certificate to you, sir. Kindly accept it.
Thank you so much.
Yes, sir.
Thank you so much to the whole team. It's my pleasure to be associated with you on a long run and in future too. Please keep up the good work for the cause of physiotherapy.
Yes, sir. Yes, sir.
Thank you so much, sir.
Thank you. Thank you.
Welcome, sir. Another supporter, Dr. Regisa Tia. She's Associate Professor, St. John's Medical College and Hospital. Thank you for supporting us for all the course, madam, especially academic side. And we will be sending this certificate to you.
And the final one for the speakers today.
Thank you, Professor Anila Paul, madam. And yes, it was a very short and sweet session. You finished, as you said, 30-35 minute session need on the scope of geriatric physiotherapy. We were searching for this topic, who can do this topic better. And Mahesh Babu sir suggested you, and he spoke to you. You agreed, and indeed, it was a wonderful session, madam. And we will be sending this certificate to you through mail. Thank you. And vote of thanks for
sir, one left, sir.
Yes.
For all our dear and respected
for all the participants. Yes.
It is the standard format. Just
you all will be receiving it.
They will have to download it, sir. When we will be releasing the link and posting the link in the group, they will be able to download it. It will be the format for them, and without them, the program is nothing. So we are displaying it. So
yes, wonderful participants actually. Thank you, and over to Dr. Danny Varghese, sir, for vote of thanks. And after, at the end, we request Mahesh Babu sir also to join out of thanks to thank all the participants and your own team and Duna madam.
You too, sir.
Yes, of course, we are there.
Thank
That
you.
is it. Over to you.
Yes, thank you, Chandramohan sir. Just a minute. Am I visible and audible, sir?
Yes, sir.
Yes,
And
sir.
even the screen
You are
is
visible and
clear.
your screen is also there.
Yeah. So time is running up, so I'd like to make it short. Good morning, good afternoon, and good evening, ladies and gentlemen around the globe. First of all, I thank the Almighty for all the showers of blessing these 2 days. Now we mark the end of a professionally well executed first ever international conference on the title GERICON 2021, which disseminated the peripheral and deep knowledge in the physiotherapy care for the older adults. First of all, I thank Mr. Anil Kumar, a visionary and an exemplary leader and a friendly human being, the chairman of Malabar Medical College and SACPMS, Sri Anjaneya College of Paramedical Sciences, for granting us the privilege to host this conference along with ExRxIndia. Please accept my heartfelt gratitude for all that you do. Thank you for giving us an opportunity to work with you. Professor Dr. Ali Rani, the stalwart in global and Indian physiotherapy arena, to come up and bless us with his encouraging words on the inaugural and valedictory function also. Please accept my thanks and appreciation, Professor Dr. Irani. A word of thanks to the eminent and distinguished guests from India and abroad, Dr. S. Swaminathan, S. Subramanian, Professor Savida Ravindra, Professor Narasimhan Swaminathan, Dr. Vijay Kumar, Professor Partha Sarathi, Dr. Kamaraj, Mr. Srijit N. Nambudiri, which represents IAP Kerala, and Mr. Govumar, which represents KPC Kerala. And from the UAE, we have the honor of Ms. Nishana Suhail. Thank you, one and all. Next, I would like to thank Professor S. Mahesh Babu, Principal, SACPMS Calicut, and the convener of GERICON 2021 to be the leading light of this conference, which truly molded us with your valuable skills and talents. And it was a privilege for us to work under your leadership. And we would love to work with you in future endeavors as well. Thank you, sir.
Thank you, sir.
Next, I would like to thank Team ExRx. What should I say? Well, dear Dr. Chandramohan, I would say You are the one physiotherapist with a master brain or supercomputer, which was for us an amalgamation of the servers, databases, and operating system in these 2 days of GERICON educational extravaganza. Thank you, and God bless your future endeavors, and especially the backbones of your team, including Ms. Juna Saga and Dr. Rubesh. We were happy with both of your presence and the services you both were given on and off the screen throughout these 2 days. Thank you, dears.
Thank you, sir. We made you all sit at one place for the 2 days. You should say that we gave you a lot of work.
And I'll just go a little bit faster by mentioning the speakers and the chairperson, which was throughout for the two days. First of all, Dr. Sheetal Raj, chaired by Dr. Manoj Abraham, and on the second day by Dr. P. Satya. Then came Dr. Binil Pillai speech, which was shared by Gladson Jose, sir. Mohammad Yasir, sir, which was chaired by Dr. R. Chandra Mohan. Dr. Girish speech was chaired by Dr. Jibuja Wagis, Dr. Annie Thomas. Speech was chaired by Professor Ramya, and Mr. Sham. While talking about Mr. Sham, I have to mention some words like, thank you, Mr. Sham, for your enlightening talk. I wish that your passion and quest for knowledge increase in you day by day, which ultimately help you researchers in the coming days. We are also fortunate to have you as a part of the conference. Please accept our thanks and special appreciation.
I'm extremely grateful for this. I'm sorry I'm interrupting you, but I really don't have words to express my gratitude. I'm really thankful to you all for everything. Thank you very much.
Welcome.
So I'm sure I said some fans, Danny Varghese sir is a first fan.
Thank you very much, sir.
Welcome. Then comes Dr. Sanjay Ipan, sir's speech, and which was chaired by Professor K. Shiva Shanmugam, sir, and Dr. Ajim Shah's speech, chaired by Dr. Annie Thomas, ma'am.
And sorry for interrupting, sir. Mr. Danny Varghese only introduced Dr. Ajim Shah.
Yes, sir. And Dr. Vijay Shilvan, sir, sir's speech was chaired by Professor Nishant, sir, and Dr. Rajisha speech was chaired by Professor Vaishali Srijit, and the last one was by Professor Anila Paul, which was chaired by Professor Anjali Suresh. I take this opportunity to thank the exemplary panel of speakers from around the globe, which delivered their personal and professional experience in geriatric medicine and geriatric physiotherapy. I would say that each one of you were unique in your field and presentation. There was no comparison at all. So thank you from the bottom of my heart, and thank you one and all. Next, I would like to thank e-poster judges from various parts of India, Dr. Pushpendra Yaduvamshi, Dr. Vinod Kumar KC, Dr. Nanshi Gandhi. E-paper judges, Dr. Arun Balasubramaniam, my classmates, Dr. Damang Vyas, Dr. Vishnuardhan GD, Dr. Srihari Sharma. thank you for coming and supporting and encouraging us, especially the student participants. Thank you all. Next, a team behind all this hard work, all this, like the show you have seen these 2 days, other than ExRx, that is nothing but the team of SACPMS. My colleagues, they work harder and dedicated manner and disciplined manner under the guidance of Dr. Mahesh Babu. You guys are awesome. Thank you all.
So much, sir.
There was a committee for e-poster. That was Mr. K. Stalin, Associate Professor, Mrs. Jyotis Maria Joss, Assistant Professor from SACPMS, Ms. Nimisha, and Mr. Jit, which was, he was Assistant Professor too. E-paper committee, which was headed by Professor S. Mahesh Babu, Mr. Jasilan M, Associate Professor, Mr. Divakar M, Assistant Professor, and Mrs. Aroma and Ms. Arunima. They both actually need an applause because they were the MCs and they were the they were the smile. Smile. They were the smile in front of the webcam, and they were representing the SACPMS throughout these 2 days. So thank you, Arunima and Aroma.
Sir.
Next, I would like to thank Sri Anjana College of Physiotherapy students and parents for their support and encouragement to make this conference a big success. And our students has given the inaugural prayer, and they are here to support us for the national anthem too. And a team behind us from the Malabar Medical College management throughout these 2 days, that is from the IT department and the MEP team and the non-teaching staff for the background support. I thank all of them. And at the last, I wholeheartedly thank for the entire participants and audiences from around the globe, including physicians, physiotherapy academicians, college principals from India, physiotherapists, allied health professionals, students, and researchers. Thank you all. And I wind up with a quote by Mother Teresa. That is, none of us, including me, ever do great things, but we can all do small things with great love, and together we can do something wonderful. And I stop with this quote with lots of love. Bye bye and see you soon. Thank you.
Thank
Thank you so
Dennis
much,
sir.
sir.
Over to Mahesh sir.
Thanks to you too for presenting such a nice, speech, Thanksgiving speech.
Thank you, Dennis sir. Almost you told not left anybody, I think so. And we are very much happy to associate with ExRxIndia, Dr. Chandra Mohan, Duna Saha Madam, and Dr. Rupesh. And some of the things memories we want to share. Just one day, I think, I don't know exactly 3 days before Chandra Mohan sir, I think so, 3 or 4 days maybe. We started working around 11 o'clock or something, and till the work was somehow the work were going till 1 o'clock night, and it was really very good support from
At the national.
really, and all our faculties were very much supported for this e-conference, and Danny sir had given a lot of suggestions and ideas, and with a lot of experience by Dr. Chandramohan sir, Duna madam, and Rupesh sir. Really, it was a very wonderful session, and for 2 days it was really very enjoyable and great learning session. And one of the students had also given feedback. I think maybe you have seen in the chat box, and they were very happy with this conference. And a few of the students told that the upcoming conference also like that. And really, I want to thank Chandramohan sir, Duna madam, Rupesh sir, Danny Varghese sir, Jasil sir, everyone here, Jit, Arunima, Roma, and Stalin sir, Divakar sir, everybody. And also a few people supported from the outside colleges and outside Kerala also. And Kerala, most of the principals also we have contacted, and all of our faculty we had given to contact a few of the colleges, and also they have contacted. And I think we have reached globally, not India, we have reached globally.
Yes,
That is
sir.
the
Actually, the reason behind that is Danny Varghese sir, who said that in Kerala we are having network issues, and also from NMIMS student, they were having COVID duties. So we considered their request. Otherwise, it could be a closed conference spot actually, happening only inside the Zoom. We cannot provide videos for so many persons, those who miss. So it is better to go on through YouTube as we planned. It was reaching globally now, sir. This program was.
Yeah, really, we were very happy. And already I told, no, Dr. Danny Varghese only introduced Ajim sir, and I think he's having some contact previously with Ajim sir. So it was also a good resource person he was so. And everybody resource person were really wonderful, and I think all the participants were enjoying all the sessions, and great learning, definitely.
Yes, sir. I
And
personally
I
would
have
like
one
to.
request, sir. If we can have a few words from Aruma ma'am and Arunima ma'am. They both did so much effort in these 2 days, and really it was very nice experience to work with them both.
Thank you so much, ma'am.
Thank you so much, ma'am. Actually, we appreciate your effort, Dr. Miss Tuna, madam. You're really nice, such a wonderful person, madam. We are very comfortable to work with you.
Yes,
Even
ma'am.
Dr. Chandra Mohan sir also. Under the guideship with Dr. Magesh Babu sir, it's very pleasure for us to work with you again in the future events.
Thank you,
you,
ma'am.
Aruma ma'am.
It was a new experience for us, ma'am, working with all of you. It was so good, so nice. Thank you so much, ma'am. Thank you so
You
much,
need
sir.
to thank Makesh sir too, because
Yes,
he
sir.
involved you too in
Obviously,
this
ma'am.
event, and I got the
Thank
chance
Mahesh
to
sir
work
for all
with you.
all the support to do all these things. Sir
And
gave the
yes.
confidence, immense confidence to do.
And just
all these
just only one thing mainly I told everybody. I don't know whether you people will believe or not. Arnima madam and Nimsa madam, everyone just this year only they joined here after completing their post graduation. With everybody. So with its youngest team, really they worked very hard. And I told everyone doesn't know all the things. Just it is just learning. Chandramohan sir, Duna madam, and everyone will support for you, and just you coordinate. That's only like that. I had given confidence, and more than you people had given confidence to.
Thank
Really
you so
to-
much, sir. Thank you so much. Thank you so much,
Thank-
Chandramohan sir. Thank you so much, Duna ma'am.
And yes, sir, with the end note, I would like to add one more point from my side. As Mahesh Babu sir said that he sat with us for, till 1 o'clock night to work. It was our regular schedule when we started working for the conference, sir. And yes, you joined with us for 1 or 2 days, but we were working behind that conference. We were working till 1 o'clock for more than 2 weeks or 3 weeks. You
For
may,
me, it is almost every day, sir. Normal schedule.
yeah, because Tuna madam was the mastermind behind the brochure, designing all those. It was a booklet. It was not a brochure. She made a book out of it. GERICON brochure.
Wonderful, madam.
Yes,
Yes,
and
ma'am.
she did a lot of work, every flyers, and yes, she worked really hard. And also she worked for the certificate also. It is not easy to create all those things to be ready at the end of the session. She's here and she is maintaining all the technical supports. He's supporting us. Every doubts will be cleared at time for mock sessions, and any help to go through technical issues, she is there. And apart from that, she kept every certificate ready. I'm very much surprised. And when we say, so, Madam, can we sit and work for certificate? She will show the design. Sir, I have done this much. And there will be little corrections here and there, and that the work is done. Thank you so much, Duna Madam, for
Thank
being
you
so
so much, sir.
And
Thank you. I am, feeling very much honored, sir. And really, I got this confidence from you and from your support. Earlier, when I was working in normal as a lecturer in a college, I was doing duties in such conferences and programs in college, but I didn't have any idea for working these webinars and e-conferences. But I really got huge support from my committee founder, and I got confidence from him that yes, I can do this and that. Thank you so much, Chandramohan sir, for being always there. And whenever I required your support, you were there. Thank you. And I also need to name about Rupesh too.
Rupesh, yeah.
He was also there. Whenever I called him, he never said no, even with too much busy schedule. He is very much busy, but still he supported us always.
Yes, we didn't miss you, Rupesh. I know that you are coming on and off. He is having a sports team, and there are matches yesterday and today. He was a sports physiotherapist. We know that you were busy, and yes, Rupesh was there to marketing for conferences, and whenever we need, he joins at first. Even on the day one, he was there. Then only he left for his work. And we are so happy to have Rupesh also always with us. His presence itself is a strength for us, actually, to speak honestly.
Invisible but important presence.
Yeah, important. And yes, I thank all the faculties of Sri Anjaneya College of Paramedical Sciences, and especially Principal Sir Dr. Mahesh, Professor Mahesh Babu, for reaching us, having some idea about to do some e-conference. We have planned for one-day event, a national event, but ended up in a successful 2 days, India's first ever International Geriatric Physiotherapy Conference, GERICON event. Thank you, everyone. Thank you, all participants.
And one more thing, sir, on behalf of all this GERICON organizing team, we all want to thank you, Dr. Chandramohan sir, and Professor S. Mukesh Babu. Thank you all.
Welcome.
Thank you both for arranging this and involving all of us and making this program successful. Thank you to you.
Thank you all. We will, Madam, I request you to kindly go off of live chat, and then we will end up with the national anthem through Zoom.
Sure, sir. I will be. But, sir, we are having the singers with us. There will be no copyright issue.
Then okay. Then yes, okay. Yes,
Aruma ma'am and Aruna ma'am, we have our students ready?
Yes, ma'am. Yes, ma'am.
Yes, we just need to stand up for the national anthem, and please make them ready for it.
Yes, ma'am. They are already ready, ma'am. You have to just take it.
We have to announce.
Okay, just let's stand up. And
yes, we will stand up for a national anthem.
So we would like to invite our college choir team to for
national anthem, please. Shamlek aunty.
I request all to keep your mic mute except the choir team.
जनगण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल गंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तब शुभ नामे जागे तव शुभ आशीष मांगे गाहे तव जय गाथा जनगण मंगल दायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे.
Thank you all. Thank you, choir team. Yes, I told
you,
to
sir.
keep the mic mute just because if on emotion, if anybody sings, that will be captured by mic and choir team's voice will not reach us. Thank you for that cooperation from everyone. And we are moving on to next session of ExRxIndia, and our participants are waiting on other side. So I say a goodbye and good night to all of you. Thank you,
Thank you
Mahesh
so
Babu
much,
sir,
sir.
and your team. Bye bye all.
Thank you, sir.
Thank you, sir.
Thank you,
Thank you,
sir.
everyone.
Thank you, Duna
Bye bye.
ma'am.
See you soon
Bye.
next.
Sure, ma'am.
Thank you all.
Thank you, Denny sir.